Good afternoon. I'd like to welcome everyone to today's hearing titled, How Secure is Veterans' Private Information? Reports from VA's Office of Inspector General, private sector consultants brought on by VA, and this subcommittee's own investigation have revealed tremendous problems within VA's Office of Information and Technology. Some of these issues have been made public in Inspector General reports which outline mismanagement of human measures and the lack of much-needed technical expertise. Other issues have been less publicized, such as those captured in the Deloitte quote-unquote deep dive that identified gaps in OI&T's organizational structure and a poorly executed business model. The latter report recognized the growth of VA by 33% since 2006, growth that is mirrored by the expansion of VA's computer network. Unfortunately, there has not been a comparable growth in the technical personnel needed to manage security of VA's sprawling network. These failures have created problems for both the department and for veterans. The Inspector General substantiated that VA was transmitting sensitive data, including personally identifiable information and internal network routing information, over an unencrypted telecommunications carrier network, both violations of federal regulation and basic IT security. The IG also noted that VA has not implemented technical configuration controls to ensure encryption of sensitive data despite VA and federal information security requirements. Similarly, it is evident that software patches are not up to date across the network. Too many users have administrative access. Security software is not up to date on older computers, and computer ports are not properly secured. There is little to no security of file transfer protocol, and web pages are vulnerable, allowing unauthorized access to veterans' unprotected personal information within the system. While these issues alone give cause for grave concern, this subcommittee's investigation has identified even greater problems. The entire veteran database in VA containing personally identifiable information on roughly 20 million veterans is not encrypted, and evidence suggests that it has repeatedly been compromised since 2010 by foreign actors, including China and possibly by Russia. Recently, the subcommittee discussed VA's authorization to operate, a formal declaration that authorizes operation of a product on VA's network which explicitly accepts the risk to agency operators, and was told that, quote, VA's secrecy posture was never at risk, unquote. In fact, VA's security posture has been an unacceptable risk for at least 3 years, as sophisticated actors use weaknesses in VA's security posture to exploit the system and remove veterans' information and system passwords. While VA knew foreign intruders had been in the network, the department was never sure what exactly these foreign actors took, because the outgoing data was encrypted by the trespassers. These actors have had constant access to VA systems and data, information which included unencrypted databases containing hundreds of thousands to millions of instances of veterans' information, such as veterans and dependents' names, social security numbers, dates of birth, and protected health information. Notwithstanding these problems, VA has waived or arbitrarily extended accreditation of its security system on its network. It is evident that VA's waivers or extensions of accreditation only appear to resolve material weaknesses without actually resolving those weaknesses. VA's IT management knowingly accepted the security risks by waiving the security requirements even though such waivers are not appropriate. This lapse in computer security and the subsequent attempts by VA officials to conceal this problem are intolerable, and I look forward to a candid discussion about these issues. I now yield to Ranking Member Kirkpatrick for her opening statement.
Thank you, Mr. Chairman. As the Department of Veterans Affairs works hard to serve the needs of today's veterans, they must work equally hard to protect their personal information. Today's hearing is an attempt to determine whether a veteran's private information is secure. Mr. Chairman, veterans need to know that when they ask the VA for services and benefits that they have earned, the information they submit in order to get those benefits will not be compromised under any circumstances. I hope that the VA came prepared today to provide assurances to Congress and veterans that their information technology systems are secure. We expect VA to also answer our questions directly and honestly. As we get questions from veterans in our district, we want to provide complete and honest answers to them. Congress received a letter from Mr. Jerry L. Davis, now a former employee at the VA, who states that, quote, there is a clear and present danger and risk of exposure and compromise of sensitive data, end quote. I share the Chairman's concern on whether VA is following the required government practices and policies regarding the monitoring and remediation of system risk. In addition, 2 OIG reports from 2012 and 2013 raise additional concerns. The 2012 report questions whether the agency has the proper strategic human capital management program to meet mission-critical system capabilities as the VA moves into the 21st century. The second 2013 OIG report faults VA for failing to secure private information by not encrypting health data transmitted to outpatient clinics and external business partners. The VA must address the concerns raised and assure veterans who come to the VA for assistance that their personal information is secure. I want to thank everyone for being here today. I would also like to thank the witnesses for their testimony and for answering questions about the security of veterans' private information at the Department of Veterans Affairs. Thank you, Mr. Chairman. I yield back.
Thank you, Ranking Member Kirkpatrick. I would now like to welcome our first panel to the witness table. On this panel, we will hear from Ms. Linda Halliday, Assistant Inspector General for Audits and Evaluations from the VA's Office of Inspector General. Accompanying Ms. Halliday is Ms. Sonia McCauley, Deputy Assistant Inspector General for Audits and Evaluations, and Mr. Michael Bowman, Director of the Information Technology and Security Audits Division. Before I recognize the panel, I ask that you please rise and raise your right hand. Do you solemnly swear, under penalty of perjury, that the testimony you are about to provide is the truth, the whole truth, and nothing but the truth? You may be seated. Ms. Halliday, you are now recognized for 5 minutes.
Mr. Chairman and members of the subcommittee, thank you for the opportunity to testify on VA's security of veterans' private information. With me today are Ms. Sandra McCauley, my deputy, and Mr. Michael Bowman, the director of the OIG's Information Technology Security Division. Secure systems and networks are essential to VA's programs and operations for delivering benefits and services to our nation's veterans. Yet OIG reports continue to disclose a pattern of ineffective information security, which places VA at unnecessary risk. For more than 10 consecutive years, our consolidated financial statement audit reports have identified IT security as a material weakness. We also perform annual reviews of VA's compliance with the requirements of the Federal Information Security Management Act, known as FISMA. This act serves as a catalyst for developing the framework to protect agency IT systems and sensitive information. As last year's FISMA audit progressed, we did note VA focused more efforts to standardize information security controls. Mid-year in 2012, VA initiated CRISP, the Continuous Readiness and Information Security Program, to ensure year-round monitoring and to establish a team responsible for resolving the IT material weakness. However, CRISP was not in place long enough to adequately improve the material weakness for last year's FISMA report. The report will be issued this month and will include 32 recommendations for improving VA's information security program. We found repeat weaknesses and vulnerabilities in 4 key areas. In the area of system access, we found password standards that were not consistently implemented and user accounts that were not enforcing minimal access privileges. In the area of configuration management, we found critical systems lacked appropriate baseline controls and up-to-date vulnerability patches. Also, the policies and procedures for authorizing, testing, and approval of system changes were not consistently implemented. In the area of security management, VA still had to address about 4,000 outstanding security vulnerabilities. We found its risk assessments and security plans were outdated and in some instances were not consistently put in place to reflect VA's current IT environment or federal standards. In the 4th area, contingency planning, we found some plans were not fully tested or updated. And in addition, backup tapes were not always encrypted prior to being sent to offsite storage. More importantly, we continue to identify significant technical weaknesses in databases, servers, network devices, supporting sensitive data exchanges among VA facilities. Many of these weaknesses are due to inconsistent program enforcement and ineffective communication between VA management and field offices. In addition to FISMA, OIG projects over the past 2 years have identified information security deficiencies, placing sensitive veterans' data at risk of unauthorized access, loss, or disclosure. Specifically, we reported on a broad range of security concerns, including VA's transmission of sensitive data and internal network routing information over an unencrypted carrier network, VA's external data sharing agreements and system interconnections, which resulted in unsecured electronic and hard copy data at VA medical centers and co-located research facilities. We reported that 48% of VA's 400,000 encryption software licenses, valued at about $5.1 million, remained unused, leaving VA computers vulnerable. And we reported on a backlog of personnel background checks, which were inappropriately prohibiting some 3,000 contractors from working on awarded contracts. In summary, our audit reports and findings and recommendations provide a roadmap for VA to improve its information security program, and VA needs to focus on addressing previously reported security issues related to the IT material weakness. They need to remediate high-risk system issues in their plans of actions and milestones, and they need to establish effective processes for continuous monitoring and to perform vulnerability assessments. Mr. Chairman, this concludes my statement, and we would be happy to answer any questions you or the subcommittee may have.
Thank you, Ms. Holliday. How effective are VA facilities with protecting sensitive veteran data?
Well, based on our oversight, we're continuing to find information security vulnerabilities at almost every VA medical center we visit. We visit 20 to 30 a year as part of our FISMA work, and we consistently find problems. The types of vulnerabilities include weak passwords, missing software patches, lack of software updates, excessive permissions, and unnecessary user accounts left on the system.
What are the foremost reasons why, after all this time, information security is still a major concern at the VA?
Let me see. I would say that ineffective access controls, ineffective configuration management controls, I think ineffective management of systems interconnection, and inadequate contractor oversight would be the four major areas.
Ms. Halliday, based on your ongoing oversight work, is VA likely to get rid of its IT security material weaknesses this year?
At this point, it's too early to conclude. We do expect that the CRISP initiative, which is starting to provide continuous monitoring, will be in place for the entire 12 months of this FY 2013 FISMA review. Our concern, while we're seeing weaknesses occur with less frequency, they are still occurring, and they are repeat occurrences and vulnerabilities that we have reported on in FY 2012 and earlier years.
What are VA's most significant risks related to adequately protecting its system and its systems and sensitive data?
Well, the first would probably be ineffective access controls. And that's where critical systems had accounts with default passwords that were considered weak passwords, easy to guess. User accounts with access rights that were not appropriate. In other words, you want to make sure that all users have a need for that information and that they have a level appropriate to that need. We also identify unsecured electronic and hard copy research data at VA medical centers and co-located research facilities. So that covers access controls. And then we have inconsistent configuration management controls. Systems include key databases supporting critical applications, but they're not patched timely or secured and configured to mitigate known or previously known and information vulnerabilities. We have ineffective management of system interconnections. That's VA-sensitive data such as health records and internal internet protocol addresses. They're transmitted between VA medical centers and the community-based outpatient clinics using unencrypted protocols. And then access control and configuration management, they're all very significant risks that VA faces. As far as inadequate contractor oversight, contractors without the appropriate security clearances are gaining access to some VA mission-critical systems, and we did report on not having all of the security clearances before gaining access to the systems with contractors.
Moving forward, what steps can VA take to prevent the loss of sensitive data?
I think VA really needs to improve its continuous monitoring process to ensure all the controls are operating as intended. And it needs to address the external organizations that it works with to make sure that they're adequately protecting sensitive veteran data in accordance with the VA policy and FISMA requirements. VA needs to ensure all service provider contracts include provisions to implement information security protections in accordance with their policies and procedures.
Thank you. Ranking Member Kirkpatrick.
You testified that there's a 10-year period of weakness and vulnerability. So there was a report given to the VA year after year after year. In that 10-year span, did you see an increase in vulnerability and weakness, a decrease? Can you kind of quantify that for me over that 10-year period?
Okay, we do an audit of VA's consolidated financial statements annually, and our contractors look at all of the controls associated with information security. They have felt that that has been a material weakness in VA for 10 full years.
Has it been the same level of weakness and vulnerability? I mean, just trying to find out if it was getting worse for a while, if it's gotten better.
I don't think you ever get the exact same level of vulnerability. I think our concern, we report out on these various problems based on the testing. A couple years ago, the plan of actions and milestones addressing security vulnerabilities was almost at 15,000 that were outstanding and unaddressed. This past year, VA has gotten it down to about 4,000, but that's still 4,000 security weaknesses and vulnerabilities that haven't been addressed. It's too many.
Do you think that the CRISP program is helping them address those more quickly?
Based on the preliminary and early testing, yes. We are still seeing and identifying security weaknesses and vulnerabilities, but to a lesser extent that we've seen that in the past. I'd also have to say that VA is actively working with us to try and make sure that they understand what we are finding as part of our FSMA testing, understand the full scope so that they can put the right fixes in place.
That was going to be one of my questions. When you issue a report, do you actually have a conversation with leadership at the VA about what needs to be implemented?
Absolutely.
And is that on an ongoing basis?
Yes, it is. With this information security, material weakness rising to the last material weakness in the department's financial statements, the secretary on down through his chain of command has had their radar on this. They're working very hard, and we have made sure that we have been communicating with the department. For example, that if we employ certain tools in our oversight to scan their systems, they're also acquiring those same state-of-the-art tools. So I think that there is an effort there, and there's, at least this year and part of last year, the communications have been better between what OIG is doing in the field, finding and getting it remediated.
I have one last question. I have a concern in your audit report. You say that you're concerned about a lack of human resources. And your statement is OIT experienced vacancies and excessive turnover in key leadership positions responsible for OIT's strategic human capital management program. Could you tell the committee a little bit more about that? What do you mean by excessive turnover?
That was the head of the program, right? I'm going to ask Sandra McCauley to take that.
If you could just quantify that if you can, and maybe give some reasons why you think that's happening.
Excessive turnover in terms of the leadership within OIT in terms of managing the programs. Turnover in terms of the program managers and project managers needed to manage each specific project, if you will, as well as a reliance on contractors to do a lot of the jobs that we really need government personnel to do.
And why do you think that there is that excessive turnover?
Some of it was, we attributed it to a lack of planning and the need for a human capital plan to really focus in on the succession planning at the leadership level, but also to better identify the skills that were needed to help manage these IT programs, and also what would be a better contractor to FTE ratio to manage the programs.
Okay. Thank you. I yield back, Mr. Chairman.
Thank you, Ranking Member Kirkpatrick. Mr. Lamborn, you're recognized for 5 minutes.
Thank you, Mr. Chairman. And before I ask my questions, I want to thank you, Mr. Chairman, for having this hearing. This is such an important topic, and there's so much going on here that I was frankly not really aware of and should have been. And we need to be aware of what's going on. So thank you for your leadership. This is so critical. Ms. Holliday, I am stunned about what's going on here. And you said in your written testimony, lacking proper safeguards, IT systems are vulnerable to intrusions by groups seeking to obtain sensitive information, commit fraud, disrupt operations, or launch attacks against other systems. VA has at times been the victim of such malicious intent. Can you tell us what you know about these malicious attacks on the VA's sensitive information? Who committed these?
Bowman, speak to this one.
Okay.
It's in his area.
Thank you. We were informed of an intrusion by foreign countries through the Network Security Operations Center. The specifics of that event, the foreign countries have actually compromised the domain controller and gained access to email accounts, and were taking email information of the senior leadership at VA. The difficult part was VA was unsure how the foreign countries gained access to the networks and what was actually being transmitted out of the VA networks back to the original source. That's the one that's most current that I'm aware of. We also reference 2006 with the stolen laptop and the loss of the 19 million medical records. But those are the two main things that come to mind. As far as our ongoing FISMA work, we do continue to identify weaknesses with the critical databases that does host sensitive data. And the web applications that are facing the internet do have well-known vulnerabilities that could be exploited from the internet. And these are ongoing from year to year. So there are significant risks out there that are related to this.
And why don't we know how much was taken?
A lot of it is having the right tools in place, such as intrusion detection systems, audit logs turned on. In some cases, VA doesn't have audit logs enabled, so it's unaware of how these systems have been infiltrated and what data has been captured and what's been transmitted. Good IDS systems on all the network segments, important to identify the attack signatures.
Okay, what is the kind of sensitive information concerning a veteran like in my district back in Colorado Springs that could have been compromised?
It's more of the personal identifiable information that you could be used to commit fraud. So if, let's say, a malicious intruder gains access to a database and has the social security number, has the names, the date of birth, they could use that to commit credit card fraud. And that's the main risk to veterans.
And with the 20 or so million veterans who are on this system, the VA doesn't know how few or how many of their sensitive information, like social security numbers, have been compromised?
That's a potential risk. Without having
it could be all of them.
Without having audit logging enabled, you don't know what's been compromised or how often those systems have been accessed in an unauthorized manner.
Would either of you ladies like to add to what I've been asking?
No, I think Mike answered it perfectly.
Okay. I'm just amazed at this. I mean, this is serious. And the VA has known about this for up to 10 years now?
We've reported significant vulnerabilities for well over 10 years, as indicated by the IT material weakness. In the last 5 years, we have increased our assessment of the security controls through our user vulnerability assessment tools, database tool, web apps tools. So we think our evaluation is more comprehensive. So in the last 5 years, we've shown consistent vulnerabilities from year to year that put VA system at risk.
And you mentioned potential state actors with malicious intent. Was that fairly recent that those attempts or those actions were detected?
I heard about that within the last year and a half.
So there's a pattern of knowing about this for 10 years leading up to a malicious capture of who knows how many social security numbers or other sensitive pieces of information of up to 20 million veterans within the last year and a half. Is that a proper understanding?
It's possible. Yeah, we don't know.
Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Lamborn. Mr. O'Rourke for 5 minutes.
Thank you, Mr. Chair. For Ms. Halliday, I actually wanted to follow up on some questions Mr. Lamborn was asking. For a veteran back home in the districts we represent, specifically, have we seen any consequences that we've been able to document in terms of their information being stolen and used by someone who's broken into this system? And not necessarily in my district, but can you point to some examples of how this has affected people that we represent?
The VA has an NSOC program where you report security incidents to them. They will prioritize it and start to work on the severity of those incidents. There's normally a good record then given of the facts of what happened, and they'll look at the controls and try to put the remediation in place. There are hundreds of incidents reported on an annual basis.
And can you take us through one to illustrate the consequences? For example, Social Security information was taken. They used that to impersonate that veteran to try to take benefits or to obtain credit cards, or...
I wouldn't have an example. We could probably submit something for the record for you.
Okay. Let me just ask you or Mr. Bowman, do you know of examples that have been documented? No. Specific consequences? I mean, I agree with what everyone has said so far. The overall problem and the threat represented by these security vulnerabilities is unacceptable and needs to be addressed and needs to be fixed. But I also want to understand the human dimension of this, what problems it has already caused for veterans, if any, if you've been able to document them. I'm assuming there have been. So anyhow, that's something we'd like to follow up on. And then I guess for Mr. Bowman, what's the expectation in terms of being able to address these? When should this committee expect to hear back from Ms. Halliday at a future hearing that these findings and problems that have been uncovered have been addressed to our satisfaction, and that we feel that we have a reasonable level of security, these threats have been closed, and we are now happy with that system? What's a date that you could point us towards?
You want me to take that?
Sure. VA plans to implement a fully developed continuous monitoring program within the next 6 to 8 months. Using that, they should have a better visibility of the security posture of their IT systems. We have 32 outstanding recommendations from our FSMA work that needs to be addressed to improve the security posture. It'll probably take VA well over a year and a half to get a good handle on that and address those issues. So if we could possibly convene maybe a year from now, VA may be able to communicate some significant progress in their IT security program. We'll be able to communicate that as well.
And just to make sure that I understand what you just said, within 12 to 18 months, those 32 recommendations would be implemented?
I don't know for sure, but I think that's a reasonable timeline if VA takes an aggressive approach for improving its security program.
Okay.
Sir?
Yeah.
We just received the official comments from received implementation plans that they will deploy regarding those 32 recommendations. There are various time frames associated with that, but our first conclusion will come at the end of this year's audit of the consolidated financial statements as to whether they would drop that material weakness or not. And there will be, all of the testing will be happening over the summer. So that report is issued in November 15th, I believe. And it will weigh in as to whether that the material weakness remains or it drops to a significant deficiency. At this point, since VA has not fully implemented its continuous monitoring, Mike is exactly correct that it's probably going to take longer than a few months to take care of this.
Okay. Thank you. Mr. Chairman, I yield back.
Thank you, Mr. O'Rourke. Dr. Rowe for 5 minutes.
I thank the Chairman. Ms. Halliday, thank you and your team for the excellent work you've done and certainly informing our committee of the problems. And this, I guess my concern is that this mirrors and patterns many of the other hearings I've been to where we can't seem to get the electronic health record fixed year after year, and it looks like that security is a problem year after year. And we just passed a bill in the House, CISPA. Most of us in this room have been to classified briefings on the security risks that this country has from outside bad actors. And I've got to go home this weekend, as every member up here does. And when this information gets out, veterans are going to come to me. There are many veterans sitting right up here at this diocese, and they're going to say, are my records secure? And I'm going to have to look them in the eye and say, no, they are not, from what I've heard. And that's not a very acceptable answer, especially after 10 years. And especially after we know the risks. In the government, you haven't looked at every other phase, but do other departments in the U.S. government share these same problems? In other words, is this a systemic-wide problem across government, or is this just VA specific? And you may not be able to answer that question.
But it is a problem for those agencies that are dealing with privacy-type information.
Right. You know, we've been asked as a Congress that we've been instructed in private that it's a severe problem for business, and we've been asked to look at some privacy issues about how you and we have a Department of Government that's not even doing what we're asking business to do right now. I think there are a couple of things that I would like to ask just briefly, and government-wide we don't know. How do we know that when we do go home, when can we say that this information will be secure? And we certainly know how when you steal private information, whether it's through somebody getting your debit card number or whatever, what it's used for. It's basically just to steal from you. So is that it, just mainly you think, or is it access to other government agencies through the VA? Is this the back door to some other agencies?
Security of veterans' information has been taken care of, I think, is at the point when VA addresses all the recommendations in the reports that we've made with regards to FSMA. We've given them a roadmap to fix things. They have, it's such a decentralized organization that they have to bring a culture of accountability, personal accountability for every action. And they need to make sure they have a consistent implementation of the policies and procedures. And we don't quite see that yet with the FSMA testing or the testing done as part of the consolidated financial statements.
Well, when you mentioned, let's say you go to a VA medical center somewhere, and you mentioned that some of the software wasn't up to date, passwords were, you can figure it out, 111, whatever, 4 ones in a row, whatever. Who's responsible for that, and what penalty is it if you don't do anything?
The responsibility lies with the CIO in the Department of Veterans Affairs, and it tears down through that organization.
Okay, but when there's when a breach occurs, what does VA do then? When you know you've been hacked or there's an attempt, let's say you haven't been breached, but you know that your firewall's been pinged. What do you do?
You assess the severity of it based on what the facts you can determine. You get a team together to look at how to fix whatever controls are needed to be fixed related to what happened. And VA has been trying to do that, but they are hacked a lot.
I'm thinking, if I am a veteran, I'm sitting here thinking, okay, we've lost a laptop computer with 20 million bits of information on it, and the system's not secure now. That doesn't give me a lot of confidence if I go to the VA to hand over my Social Security number and all that.
Right. VA did mandate cybersecurity and privacy awareness training nationwide to bring down a level of personal accountability to every individual that's doing work and touching veteran-sensitive information, to make sure it brought accountability to this process and makes individuals actually sign a statement that they will protect the veterans' information. So that is a step in the right direction.
Ms. Halliday, thank you, and I think we have our marching orders, and we'll hear from the other two panels, but I think in 12 months, we should be able to sit here or less and be able to look our veterans in the eye and say to them that your information is as secure as we can do it. I understand there's nothing that's 100%, I got that, but it's relatively secure. Am I correct in that?
Absolutely. Both the prior VA secretary and the current have asked for the gold standard in protecting VA's veterans' information, and I think the expectation should be nothing less.
Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Chairman, Ms. Holliday and your team. Thank you once again for coming. Again, we've been through these hearings and we listened to them. I guess the part I'm getting at is, and many of us, myself included, I've been advocating for more sharing of data, especially between DOD and VA. Been advocating for being able to get some of that information to some of our partners, like the County Veteran Service Officers, to help with claim processing. Advocating for bringing in private medical data into the system to help speed the claims process. With that being said, with the VA and its research partners, how do they do the formal agreements between them? And I guess the point I'm getting at here is this issue we're addressing, and I would assume you have lots of contact with your private sector counterparts and best practices. This very same thing happens in the private sector, correct? But there's no requirement for them to report when there is a breach. So we have no, is that correct?
Pretty much, yes.
Would you say how are these agreements done, and if there's a breach at a research institution on the private sector side, how do we know they're reporting that breach back, and who is ultimately responsible in those agreements?
Basically, you need a formal agreement that outlines the roles and responsibilities of both the external partner and the VA. In that particular instance, we see some real inconsistencies and a lack of some of these agreements not being put in place. The second you would like to do is make sure that whatever arrangement VA is entering into, that organization has commensurate controls with VA so that they can adhere to our policies and procedures.
But they're not required to adhere to PHMSA, is that correct? Private
right.
entity?
But you can establish those terms in these agreements, and that's where you should do that, because if you have one side securing veterans' information very tightly and another handling it very loosely, you have a problem.
Is it safe to say we then do not know the scope of the problem yet if those are lacking? Because there are many, many of these agreements.
Absolutely.
Okay, so we have no idea on the scope of that.
Right.
When you're looking at this, where is the model? Is there an entity, an institution that's out there that is the gold standard of best practices? How should this be done? I mean, there are standards and protocols that should be implemented. Who's doing it on the scale of a VA? Is Citibank doing it? Are these fake? Is Credit Suisse doing it? Who's doing it that it looks correct? Because the targets here aren't necessarily veterans because they're veterans. They're targets because they're easy. Is that correct? Or they're trying to make it easy in many cases. Can you give me an example of who's the gold standard?
We can't give you an example. Sorry.
Is that for lack of your knowledge on what others are doing, or is that because there might not be one?
I would say more lack of our having direct knowledge of who's actually performing. Some people might attest that they do have a gold standard, but when you look behind it and you see breaches and problems with that, we haven't looked at that, so I can't really...
If we had some of them here to talk to us about the problems they're having, that might help us get an understanding of this and let the VA bring some of those things in.
I think there's always an opportunity to bring in best practices from the outside.
Okay.
And from other federal agencies.
So if we implement all the protocols that you put out there, and I think you gave me the number of 4,000 potential weaknesses or vulnerabilities, if we implemented all of those and we're able to do it, what's the cost associated with that? I understand what the cost of not doing it is great. It's a breach of trust and security of our veterans. What's the implications? Is that not something you factor in when you do your assessment?
Sir, I would not have that answer, but you should ask VA.
Okay, very good. All right, well, again, I thank you for your service. It's invaluable, as I always say. The more that we can do to support the IG, the better government we get out of it. So thank you.
Thank you.
Mr. Huelskamp for 5 minutes.
Thank you, Mr. Chairman. I appreciate you providing the opportunity for this hearing. And I must say, I have a lot of words to describe my feelings, and embarrassed by the actions or lack thereof by the VA might be one of those. Shocked, surprised. I guess I'll probably be even more surprised by later testimony. But if I understand correctly, one of the things you did mention that there was a violation or personal emails of the secretary and high-level staff were compromised. And can you describe that a little bit further?
And my understanding is that when the domain controllers got compromised, they got access to the senior leadership emails accounts. And there is information that indicates that those emails were actually exported outside the VA network. The value of them is unknown. What they did with those emails is unknown. But whenever you compromise a domain controller, essentially you own the enterprise. That's the seriousness of it.
Yeah, and I appreciate that. You own the access to 20 million records, plus that of their dependents. What was the VA response when you brought that to their attention?
It wasn't formally communicated to me. I heard it in a meeting that was discussed between the NSOC, and they probably were unaware I was listening in. But that is just what I heard just by observing some of these meetings and describing these events.
And this is very shocking, Mr. Chairman. I know we have a letter in front of us from a very high-ranking official at the VA that says, quote, VA security posture was never at risk. Was never at risk. And that's a quote from a high-ranking official. And I would guess that perhaps they used email to put this together. Can you imagine the thought that the folks that were hacking the system were actually reading this email as they were exporting 20 million private records? And you indicated we do have evidence potentially of external state-sponsored espionage that might be occurring through the VA. One of you had indicated that was a possibility?
That's my understanding.
Okay. And did you bring this to the VA's attention, and what was their response?
We haven't, with the FSMA work, we haven't specifically addressed that issue. We do get into incident handling and monitoring, and we identify every year there are network connections that aren't being monitored by VA. So the risk is that you could have systems compromised, data being transmitted externally, and VA could be unaware of it.
They could be unaware that the information is actually leaving, and if asked, they could potentially, even under oath, say we know of no such transmission, which, if I understand correctly, might absolutely be true, and would suggest, obviously, when you've given up control of the system, like you indicated, you would have actually no idea of the threat then.
That's correct.
Sir, one of the things that we do as part of our oversight, and we try to do a lot and gain an understanding of what is happening in VA environment, and then we send information to our contractor who is doing the actual FSMA assessment to put the right steps in place to do full evaluations to truly understand the risk. That's all happening as part of the process.
Yeah, I appreciate your work. I mean, you have a very difficult task of identifying the problems and hopefully providing some solutions, but it's up to the VA, maybe after 10 years, to finally implement some of those. The latest thing I see in your report is an incident from March 2013 in which sensitive private, perhaps medical and personal data was transmitted over an unencrypted telecommunications carrier network. Can you tell me what happened when that personal data was transmitted unencrypted? Apparently, VA did not know they were doing that. What's their response? You indicate that the management acknowledged this practice and formally accepted the security risk. Did they identify who was at risk, how they were at risk, and did they close this security gap?
That's your report.
Yeah, we received a hotline complaint discussing the transmission of unencrypted data between the medical centers and the community-based outpatient clinics using unencrypted protocols over a telecommunication carrier network. And we went and discussed with the network engineers and various levels with VA, and they admitted that this is a common practice. This is how PA...
No, this is a common practice.
It's a common practice, but a mitigating factor is they logically segment that traffic from other customer traffic. The downside of that is it still needs to be encrypted, and there are technological solutions that can encrypt that traffic when it's outside of VA's span of control. Now, VA responded to that report by saying they plan to implement encryption controls, so that will improve that risk of losing that data as it leaves VA's span of control.
And sorry, Mr. Chair, one last question. So they plan, do you know if they actually have implemented the encryption to protect
My
sensitive
understanding
data?
is the edge router encryption controls have not been implemented yet.
Well, I yield back, Mr. Chairman.
Ms. Walorski for 5 minutes.
Thank you, Mr. Chairman. I appreciate the report. I appreciate the information. I will tell you, when I was in the Indiana House, we did hold companies responsible for these massive breaches of identity theft, especially when a Social Security number was in the breach. And so we did have legislation, and we still do, and I think 17 or 18 other states now have it as well, holding private companies responsible. And if there's a breach, that the buck does stop with them for immediate information sharing, and in some cases, freezing credit reports. So my first question is on this information that as it's leaked to a veteran in my district, say their Social Security number was accessed, are any of those Social Security numbers redacted, or is this just free-flowing raw data that's going out the door?
It's unencrypted.
Well, we don't have knowledge of any specific cases of data loss other than the 2006 example. And in those cases, VA is responsible for providing credit reporting services to the veterans who have been harmed by this. But what we try to indicate that using unencrypted protocol, the risks remain, that the potential is there, and that VA needs to implement these proactive controls so these type of events do not occur going forward.
But in light of the answers to the various questions up here, there obviously has been more than just one incident in 2006 when that information has been available. And so, you know, I think about this in my district. I have 52,000 veterans in my district, and then their extended families. And I'm thinking, you know, if this happened in the private sector, they would automatically, this would have triggered just the suspicion and the not knowing would have triggered an automatic credit freeze to the people that would be living in my district. So, you know, I'm looking at this from the standpoint of saying, you know, sending out an APB when I get out of here that says to the 52,000 vets in my district, better check your credit report because we have no idea that your information has not been breached. And to continually check that. And as we continue to tell people, you know, to go access their VSOs and go access their facilities because of this long wait and you know, the things we deal with on the veteran side is how at risk they are with sharing that information in today's day with these violations. In the private sector, this type of an entity would never survive. The lawsuits that would come would shut them down because of private information being at risk and being taken and nobody responsible. So it's absolutely baffling to me that in addition to some of the other things that we've heard in this report, that the buck stops with the CIO and we've had nothing but turnover, as you've reported, in this entity of this area of the VA to begin with. Has anybody ever been disciplined based upon the findings of your reports?
We can only make a recommendation. It's up to the department to take the administrative action. That's the extent of our authority.
Have any of your recommendations involved issues of employees or incompetence or training or things actually for the people who are actually working there taking this information?
Yes, I would say several, especially with our administrative investigations. It's looking at very specific personal accountability for actions.
And are you asking specifically that supervisors and managers and CIOs and these kind of people that have been in charge of where the buck stops with this information, that they be disciplined if not terminated?
We make a recommendation for appropriate administrative action and then generally give a discussion with that.
And is the appropriate action usually termination?
The federal government would apply.
I'm not familiar with the protocol. What is the appropriate action on something like this large of a risk to this many people?
You would have to look at the severity of the incident, determine the exposure, determine what the accountability was. Was it intent? Was there intent? Was this a mistake? that they may not have been able to prevent. And then when you do that, you apply the Douglas factors for discipline actions in the federal government.
But my understanding would be in the last 10 years, based upon the previous questioning, that the 40 or so outstanding compliance issues that you have advocated that they follow, had those been followed in the last couple of years, we would have remedied this situation. So there has to be some kind of accountability still and disciplinary actions and buck stops someplace with this staff, correct?
We absolutely think the department should have implemented many of the FSMA recommendations and tightened controls early, and they would have less problems if they did that, less security incidents.
Thank you. Thank you, Mr. Chairman. I yield back.
Thank you, panel. I appreciate your testimony. You're now excused. I now invite the second panel to the witness table. On this panel, we will hear from Mr. Stephen Warren, Acting Assistant Secretary for Information and Technology at the Department of Veterans Affairs. Accompanying Mr. Warren is Mr. Stan Lowe, Deputy Assistant Secretary for Information Security from the Office of Information and Technology at the Department of Veterans Affairs. Before I recognize the panel, I ask that you please rise and raise your right hand. Do you solemnly swear, under penalty of perjury, that the testimony you are about to provide is the truth, the whole truth, and nothing but the truth? You may be seated. Mr. Warren, you are now recognized for 5 minutes.
Chairman Kaufman, Ranking Member Kirkpatrick, members of the subcommittee, thank you for inviting me to testify regarding the Department of Veterans Affairs Information Technology Security Program. Accompanying me today is Mr. Stanley Lowe, Deputy Assistant Secretary for Information Security. There is no higher priority than protecting the data that VA holds on our nation's veterans. I, as well as the many IT employees at VA, over 56%, our veterans themselves, take this responsibility very seriously. As the committee knows, the department received a wake-up call from the stolen laptop incident in 2006. As a result, the VA consolidated its disparate IT functions into a single, unified IT organization. VA's consolidated IT organization is responsible for providing the tools, services, and systems that are necessary to protect veterans' information in 153 hospitals, 853 community-based outpatient clinics, 57 benefit processing offices, and over 160 cemeteries or memorial sites. Our network supports over 400,000 users and over 750,000 individual devices. We are committed to protecting the information we hold on millions of veterans, their beneficiaries, and more than 300,000 VA employees. As we all know, IT security threats continue to evolve. To that end, we have implemented our continuous monitoring program, which continuously checks all IT systems and monitors every device attached to the VA network. VA launched the Continuous Readiness and Information Security Program, or CRISP, in 2012 to proactively address process and policy deficiencies as well as architecture and configuration issues. As part of the CRISP effort, the VA conducts rigorous vulnerability scanning, continuous monitoring of patching and software inventory, implementing port security, antivirus services, and encryption of non-medical IT desktops and laptops. Through web application security assessments, VA is able to identify critical vulnerabilities and potential exploits in VA systems. We protect the network infrastructure by identifying all network assets, critical database stores, all external connections, and provide the trusted internet connection gateway services. In the past year, VA has measurably improved its security. The department has ensured that over 98% of VA staff have received the mandatory security training they need to protect the information of veterans and their families. Only staff turnover prevents us from reaching 100%. After the 2006 incident, VA worked to ensure its laptop computers were encrypted to provide another layer of protection. Currently, over 98% of VA's non-medical IT laptops are encrypted. The department aims to complete the encryption of the final 2% by June 30th. VA has a robust data breach notification process using a data breach core team. When the team determines that a potential breach may have occurred, they notify affected individuals and offer credit monitoring. VA also posts a monthly report of data breach notification on its website, and this report is provided to Congress in addition to the required quarterly data breach report. VA has become one of the very best large organizations of providing notification if a potential breach occurred. This law requires notification within 60 days. A review of VA's incident tracking system over the current fiscal year indicates that VA takes on average 25 days to provide notice. VA's standards and practices exceed even the strictest federal, state laws and policies. I would like to update you on our progress to extend VA's authority to operate, or ATOs. Before giving you this update, I would like to assure the committee in the strongest terms that at no time was veterans' data placed at risk by this process. The signing of an ATO represents the final step in what is otherwise a continual process of security and management reviews. As the committee is aware, VA has been working to extend nearly 600 ATOs over the last several months. We have worked to assure that requirements for each ATO are properly conducted and documented. VA trusts the ATO validation process and the work of the information security officers, facility CIOs, and system owners to ensure system security. This paper-based process validates that critical steps are being taken to protect our veterans' data. Mr. Chairman, VA places the highest priority on safeguarding veterans and employees' personnel information. We are committed to information security, and although work remains, VA has made significant improvements in the last few years and strives to meet those highest standards in protecting our nation's veteran-sensitive information. Thank you for your continued support of veterans, their families, and our efforts to protect veterans and their information. I'm prepared to answer any questions by the ranking member, the chairman, or the members. I need to adjust this chair if I can. Thank you.
Mr. Warren, given your knowledge of visitors in the network since 2010 and understanding that there were significant security weaknesses, why would you insist on conveying the message that veteran data is not at risk?
Thank you, Chairman. I think that actually is a great question to ask within the construct of information protection. I think it's very important to note that my partners in the Inspector General's office used words such as could, might, potential, possible, is possible. When an audit takes place, when a review takes place, the focus is on what could happen. But remember, the existence of a risk is not the same as the removal of information out of the network. Several things need to exist. What needs to exist is the potential, and we try to drive those down as quick as we can. There needs to be an actor who has access and the ability to get to where that risk is. They need to be able to do that in such a way that they are not seen, and then they need to be able to move the information out of the network through all the sensors and past the gateway, as well as past our partners in DHS who are watching outside our gateway, and then remove it. So the piece we need to be very careful of is we're talking about potentials, we're not talking about actuals. And so
I'm sorry, how do you define the difference between an actual and a potential? And I'm looking at an internal report on August 15th, 2012, and it talks about an actual, at least it talks about that the network was penetrated. So how do you define actual versus potential?
Sir, I don't have that report in front of me.
I'll make it available to you.
And I will gladly respond to the record, sir, in terms of that specific incident.
Okay. I'm sorry, please define the difference between actual and potential.
Potential is, and we'll do as an example, your home computer. So if you do not update your...
How about we just stick with the VA system?
Sure.
Let's talk about that.
We can talk about a desktop computer. Once a month, Microsoft puts out a set of packages on Tuesdays. So every Tuesday, once a month, the first Tuesday, Microsoft sends out a full set of patches. If we do not incorporate those patches into the system, the potential for somebody going to a website and the potential being exploited goes up. But the VA has a very aggressive program to make sure those desktop patches happen once a month, as Microsoft puts it out. So if you don't do them, and you don't do it over multiple months, the potential for the desktop to be compromised and the system itself to be compromised goes up.
But it's my understanding you have not instituted all the patches in the VA system. Is that correct?
I'm sorry, I missed the first
That
part.
you've not instituted all of the patches in the VA prescribed for the VA system.
I would tell you, Mr. Chairman, that we have a very aggressive program to make sure the desktop computers are patched.
You're not answering my question.
The intent is not.
To the VA system. Is it true that not all the patches have been applied as prescribed in the VA system and the information network?
So there are about 750,000 devices in the network. So if you're asking, does every single one of those devices have every single one of the patches that their manufacturers put out? The answer would be no, because there are multiple times when that patch will actually break the application that you need to use. And therefore, there's a waiver in place that says you don't patch that system because not working is actually worse than a potential risk within an environment which is...
Mr. Warren, why did you not previously disclose to the committee that VA has had serious and continuous compromises of systems and data by nation-state sponsored actors?
With all due respect, I do not believe it is a true statement, as you laid it out, that the VA has been continually compromised by foreign nation states. We have a strong partnership with Homeland Security, which watches the boundary for the department. I'm aware of a single...
Mr. Warren, has a foreign entity targeted and penetrated our network?
I am aware of a single incident that our network operations center identified.
And when was that?
It was last year. I will need to get back for the record in terms of the specific date.
Very well, when this, I will make this internal document available to you, and I think you can be informed that there actually have been quite a few breaches. Ranking Member Kirkpatrick.
Thank you, Mr. Chairman. I'd like to follow that line of questioning. Mr. Warren, if the system is compromised, would you know that, or is it possible that it would be compromised and you would not know that?
I would tell you with controls that we have in place, with continuous monitoring, as well as the work that we do at our boundaries with Homeland Security and our NSOC, the probability of somebody being in the network and compromising a system without us knowing it is very, very low. But I can't argue the absolute.
Can you provide for the committee how many times the system has been hacked since the beginning of this year?
I will gladly provide that for the record, ma'am.
Thank you. And then was it your testimony that it takes you 25 days to notify the veteran that their personal information may have been compromised?
Yes, ma'am. If I could expand on that.
Would you expand on that? Because that really concerns me, because in 25 days, everything could be wiped out for that person. So please.
Certainly, ma'am. What happens is, as soon as, and the VA has a 1-hour reporting requirement, as soon as an employee believes the potential of something happening, they're supposed to notify our NSOC, and it is part of the reporting we do. At that point, we pull the team together and we ask the question, what and why, is it real? And if it turns out we have an issue, the data breach team, which meets once a week, which is made up of career staff who are outside the chain of command, they do the analysis of that potential breach, and they determine if the potential was high enough that data had left. And normally, if there is just a little potential, the department goes ahead and reaches out to all of those veterans with credit monitoring for a year. And the 25-day period is the time for the notification to the NSOC, the establishment of the team, the analysis of the data to make sure what was reported was actual. And in many cases, and in fact in most cases, it's the potential that is reported, and we reach out to veterans anyway, and we offer that credit reporting.
How many times have you had to notify veterans within the last year?
Ma'am, I will get you that for the record in terms of the number of times that we notified veterans and offered credit reporting as a result of a potential data breach.
Thank you. And then was it also your testimony that by June 30th of this year, your system will be encrypted?
Actually, my testimony, ma'am, was that for all non-medical IT laptops, so the ones that are under my responsibility, we will have the last of those encrypted. It is.
But the medical laptops will not be encrypted.
No, ma'am, and the ranking member, the difficulty we have with medical devices is they're constrained by their certification from the FDA, and the concern is by putting encryption on that laptop, a medical device that has a laptop in it, you will actually impede the ability of that medical device to do its job. And so we've had lots of conversations with the FDA to figure out how you can do that. But when a device is certified that has a medical device in it, the condition of the device at the time of certification constrains what you can do it afterwards. And so to handle that, we actually have a separate area, an isolated area in the VA network where we put those medical devices that are based on IT equipment. And we also go further by working with our partners in VHA, where we start testing those devices to see if there is an impact to its job in terms of delivering care, or if we impact their certification boundary. And in cases where it isn't, and there is a tool called barcode medication, which is what the nurses move through the wards, we were able to show that there was no impact. Those medical device laptops are now encrypted. And so we work our way through that with our partners in the health administration and their biomed folks.
I have one last question. Are you familiar with, or you heard the Inspector General talk about the fact that there's been excessive turnover in key leadership positions and there's a lack of human resources in the IT departments? Do you agree with that statement?
I would tell you that an organization going through transformation is a difficult place to work because everything is moving around you. And so we have had transition of staff. We've had transition of staff going out and coming in. This year, I believe I'm 100 folks below my ceiling of about 8,500 individuals.
Do you have a strategy to address that so you have adequate human resources?
We do active recruiting. We work with the HR organization to figure out how do I do pools so I can make sure I've got project managers lined up, to make sure I have individuals lined up to bring them in. We also have a very strong focus on veterans. As an example, last year, 75% of my new hires were veterans, because that's very important to me as a veteran to make sure we're bringing our clients, if you will, into the organization to help us do a better job.
Thank you, Mr. Warren. I yield back.
Mr. Warren, please be reminded that during the course of this oversight hearing and committee investigation, it is a federal crime pursuant to 18 United States Code Section 1001 in pertinent part, knowingly and willfully to falsify, conceal, or cover up a material fact, or to make any materially false, fictitious, or fraudulent statement. Mr. Lamborn, you have 5 minutes.
Thank you, Mr. Chairman. Mr. Warren, members of the previous panel testified under oath that foreign state actors have accessed sensitive information of veterans within the last 2 years, and that the VA does not know how much information was stolen. Would you agree with that statement?
I would say, Congressman Lamborn, there is that potential. I would tell you that working with our partners at Homeland Security in terms of where they watch our gateway, so it's not just the VA connected to the world and everything happens. We have Homeland Security, if you will, at the gate. So I have our team on our side and the Homeland Security on the other side. And between the two of us, we watch all the traffic going back and forth. So the ability of material to move, yes, there's always the potential. We referred to a particular incident that the Inspector General talked about. I was aware of that incident. So I would tell you that one we know happened. With the other ones, it's still the potential and the probable in terms of...
And of the one that you will admit has happened, we don't know how much information was taken because it was encrypted before being exported. Isn't that correct? So we don't know how little or how much the data was that was stolen.
Sir, my recollection of that report, and what I'd like to do is go back and review that report to give you the answer in terms of what came out and what the report was able to tell us given the conditions that existed.
What kind of dependent information is put into some veterans' files?
I would tell you, Congressman Lamborn, the veteran files are held in many locations in the VA, in many systems, whether in the electronic health record or whether in the new, used as part of the new VBMS system, as well as all the other systems. So the information necessary to provide benefits or services is what we...
So that it can include the names and social security numbers of dependents?
If that's required as part of the claim or service processor.
Another problem I have is, and this happened to me recently, I got a credit card in the mail. It turns out that my credit card issuer had been compromised, so everyone had to get a new credit card. And we had to go back and change the numbers on all our accounts. It was a big hassle. Fortunately, nothing was stolen that I know of. But what happens when a social security number is stolen? You can't replace that. I mean, we're talking about something really serious here. Are you aware of how serious this is?
Congressman Lamborn, we take any potential incident and any incident very seriously. I take it personally. It's one of the reasons why the VA offers credit monitoring. So even when there is a potential, we reach out to the veteran and we offer them that credit monitoring for a year. We also have a 1-800 number that we've made available to veterans if they have any questions, so that they can reach out to us if by chance something does happen, so we can help them, walk them through that process.
You said earlier that we placed the highest priority on protecting this information, and yet members of the OIG indicated that for more than 10 consecutive years, independent public accounting firms under contract with OIG have identified information technology security controls in the VA as a material weakness. How can that condition have persisted for 10 years if that's your highest priority?
Congressman Lamborn, thank you for that question. I would tell you that material weakness is actually a financial term. It's the same type of term used as part of Sarbanes-Oxley in terms of laying those financial controls on the organization. So the material weakness says there is a question about whether the financial data in the system is secure or not. So material weakness, yes. I will tell you that as an organization, the department wasn't going, hey, yeah, we got a material weakness, move on. Every year we took the inputs, and I've only been with the VA for 7 of those 10 years. Every year I've been there, we took those inputs and we laid out what we needed to do. We laid the resources on it. We put focus on training, and I will tell you it wasn't enough. And so 2 years ago, this major effort of doing CRISP, of taking the whole organization, not just the IT organization, but taking the whole organization, because information protection is not just an IT thing.
Well, I'll agree with one thing you just said when you said it wasn't enough. I certainly agree with that. And how do we know that there isn't going to be some kind of document dump by a foreign actor, WikiLeaks or something like that? I mean, there are so many things. Healthcare records. There's such sensitive information in healthcare records. So we're not just talking about Social Security numbers. There's healthcare records. We shouldn't be here today, and I am sad that we are at this juncture right now. Mr. Chairman, I yield back.
Thank you, Mr. Lamborn. Mr. O'Rourke.
Thank you, Mr. Chairman. For Mr. Warren, I'm not as conversant in the details of these issues and the different systems and protocols involved as I would like to be, but I think it's fair to say that the picture you paint of the VA's IT system and the vulnerabilities is very different than the one that we just heard from Ms. Holliday. And I think you heard many of us say that what we heard presented was unacceptable in terms of the vulnerabilities, unacceptable in terms of the amount of time that the VA has known about those vulnerabilities without successfully addressing them. Some concerns about when information was reported to this committee and others in terms of breaches to the system and retrieval of information by foreign actors. Can you just, so in general terms, that I can understand, address that discrepancy from what we just heard to what you're presenting? You seem to be saying that things are generally under control.
I would tell you the state of security and the work we need to do is something that I wrestle with all the time. Am I satisfied with where we are? No, I'm not. Can we do better in terms of fixing the things that our partners in the IG and the audit community have identified? Yes, and we are dedicated to doing that. But the difference that you are hearing from myself versus the audit community is they have to deal with potential. Is there a chance? Is there any opportunity for something like that to happen? And the answer will always be yes. It will always be yes, that there is the potential. So if you ever ask me, or even if you ask me today, can I guarantee that everything is perfect and wonderful? I could not give you that guarantee, because it's constantly changing. The technology constantly changes. So my focus is more of a very pragmatic, operational person whose job is to try and make sure we continue to deliver those benefits and services in a way that has the least risk, the one that does not put our veterans' information at risk while we do that. And again, is it where I want it to be? No. Do we continue to drive on getting it to where we need to be? Yes.
Well, in terms of the 32 recommended steps that need to be implemented, and I asked the IG's office about what the time frame would be to implement those. Do you agree that it's a 12 to 18 month implementation time frame?
Yes, sir. And in fact, when the report gets published, you will find there's a departmental response, and it actually lays out what it is that we have in place and what we are going to do. And I believe the latest date I have when I signed out that document with all the different organizations was September 2014 for some of the longer items. And I believe that fits within that 12 to 18 month period. But there are many things that are happening now. We have some significant things coming online at the end of August. There are things taking place between now and August, but the longer, harder ones take that extra time to get there.
And so there are no fundamental differences between your office and the IG's report in terms of what they just described to us in their findings, their vulnerabilities, and the seriousness of those vulnerabilities and threats.
I will tell you, there are many reports referred to in the prior panel. You will find that if you look at the report and you look in the appendix, the place where the department did not agree with the findings, you will find a statement in there that says, again, we always thank our partners to come in. We see them as part of the team. They give us that outside view. But where we disagreed with what their observations were, we normally state that in the document. So given the chairman's reminder, I need to make sure that where the department did not agree, we state it in the report. And we also state what it is we're doing as a result of what they find and what our plan of actions are. And then we give a quarterly update to all of the things that we said we were going to do. And as the acting assistant secretary, I sign off on every one of those quarterly reports in terms of what we said we were going to do, what did we do to ensure that we are responsive not only to what the inspector general identified, but ensuring that we're doing everything we need to do to protect our veterans' data.
Let me ask one more question. You've used the terms possible, probable, and actual several times in response to our questions. A question I asked of the previous panel, can you tell us of an actual incident where, because of a security vulnerability, private information from a veteran was retrieved by someone to negatively impact that veteran, whether they stole their social security number or other personal data that was then used to harm that veteran?
I am aware of several incidents, and I'll describe one for you. It's an individual who he was a system administrator, again, not foreign, but domestic, accessed the database and used the information there to do identity theft. When identified, we refer those to the IG, and they bring in criminal investigations. So in that regard, there was an individual who breached the system. It is always referred to law enforcement. It is always referred to law enforcement, and then we provide credit monitoring, and we also work with the law enforcement folks to make sure that they have full access to do what they need to do. So I will tell you, large organization, lots of people. There are going to be folks who do bad things. As we find them, we refer them to law enforcement for them to take action, and then we just keep, as a result of what we saw, what then do we do, right? How did that person get in there? So you will see there's a very strong personal accountability program the department is bringing on board to go ask the question, are we hiring the right people? Do they have the right credentials? Are there flags here on their personnel records such that we really shouldn't be putting them into a position of trust? Not an IT thing, but the broader aspect of how you hire folks and how do you make sure you're bringing in the right folks.
Thank you. Thank you, Mr. Chairman.
Just real quick, when the OIG in their report said that their system got hacked by foreign, when the OIG said that their system got hacked by foreign actors, did you refute that as part of your response?
So again, I believe you're referring to that August report. Let me just make sure what you're referring to, Mr. Chairman, if I can. Because I don't have enough information to answer your question, sir.
So you're not aware? In the OIG report, in their testimony when they were up here, they referenced that your system got hacked by foreign actors. Now, well, first of all, do you acknowledge that?
I believe I already have in my testimony, Mr. Chairman.
Yes or no?
Yes.
Very well. Dr. Poe for 5 minutes.
Thank you, Mr. Chairman. And a couple of questions that Congressman Lamborn talked about. One of the reasons that, the way I understand this from listening this afternoon, that you might not know what information's going out is that the information that people were after was not encrypted. But on the way out the door, it was encrypted, so you couldn't read what was gone. So you could truthfully sit there and say, we don't know what's been stolen because you really don't know. And it should just been the other way around. We should have had the data encrypted so that nobody could have gotten a hold of it or done anything with it. Am I right or wrong with that? I misunderstand.
No, Congressman Rowe, you are actually laying it out appropriately. And again, with the report that we're referring to, glad to do a private briefing to the committee with the details because of some of the issues around it. I will tell you that the area where the individuals were in the email area in terms of pulling emails out. The one compensating control, or the thing we do as well, is many of our emails are encrypted. So the reference to unencrypted is information in databases. This particular information, which I believe is being referred to, deals with folks who went after email packages. In many cases, those are encrypted such that it would be difficult to read them. But again, because, as you rightfully pointed out, the data left the network encrypted, it's hard to say yes or no what it was.
I understand that now. And let me ask, would any of this other information, since do you cover the part of the VA that is involved in contracting? Is that data not just personal information, but is contract data? In other words, if I'm bidding on a project out here, would a foreign competitor know what that contract was? Because we certainly have seen that in other areas. Is that possible?
Sir, I can't refute the possible of any scenario in terms of, again, there are no absolutes in information security. We strive to make sure there aren't.
Let me stop you there. I've heard that before. This August 15th, there's an Officer of Information Security, and you stated you had been, at least were known of one time that I think that I understood this, that you'd been hacked or pinged. March 10th and onward, the deep dive analysis has been tracking activities of well-funded cyber espionage teams that regularly target VA. Over the past 31 months, the DDA, that's the direct dive analysis, has identified 8 of these teams as part of our threat program. Each team is assigned a name, I won't go through that. Assigning a common nomenclature has allowed them to attribute each of their campaigns and see which one of them is the most effective. And it goes through how they were doing it. Are you aware of, I'm sure you're aware of that.
Yes, sir. The key reporting and the fusion technology team, so the individual whose report you're reading from, is an initiative that I started in terms of asking folks to go out and start pulling data and understand what was going on. But I think what you will
clear me up, because
see is,
you said you only heard of one, you only knew of one incident, and yet you started this, which there are 8 different teams that are looking, and it appears that from this information we have, which it makes sense that they most likely are most like to hack us during holiday times, which makes sense. Your defenses are down. Thanksgiving, Christmas, those times when we'll be less, our defenses are up less.
I think what you'll find, sir, if you read into that report, it's targeting. So the report, again, it's a very aggressive defensive policy in terms of, through our network security folks, is trying to identify where the threats are. Now, again, the August report, we talked about the specific instance where we saw the material leaving and some of the things that we did as a result of that. You will find there are reports like that that are published probably a couple of times a month from the Fusion team saying, this is what we're tracking, this is what we're monitoring, this is what we're doing about it.
But you wouldn't be tracking those if they weren't active.
There are things known as honeypots, black holes, where the individual may try to come in, and what you do is you set up your perimeter so it looks like they're actually getting into data, but they're not.
Okay.
You're actually tracking and capturing them. The other pieces, if I could, is there are actors you see inside, but you also set it up on the outside, where if they are trying to send data out, you basically put a trash can where the data goes versus leaving the department.
I have some more questions on that to see how many times that has happened. And there's a note here I have that it says over 400,000 systems in VA's network do not even have a basic security baseline installed. Is that correct or incorrect?
So I would need to basically validate where that report is coming from, and I will take that for the record.
And lastly, just one quick question. Who are the state-sponsored actors that we're dealing with? We haven't called any names, but who are they?
I would tell you, sir, that my preference is to do that in a closed session. Otherwise, I would put my clearance at risk as well as the fines and penalties.
That's fine. That's fine. I yield back.
Mr. Walz, for 5 minutes, please.
Thank you, Chairman. Thank you, Mr. Warren. Your data is on those computers too, correct, as a veteran?
Yes, it is, sir.
Okay. And you were over at FTC and DOE?
Yes, sir. I was at the Federal Trade Commission where I did the National Do Not Call Registry, something I'm very proud of, as well as annual credit monitoring that you can get, and then at the Department of Energy with the weapons cleanup program.
How does your knowledge over there, does the current job you're in correspond with you having a knowledge of those organizations and their ability to provide security over data? Because I'm assuming both of those have very sensitive data, especially DOE, in terms of state secrets and things like that. So is there a comparison there? Can you tell us how they function or how VA's system is in terms of robustness compared to those?
I would tell you, sir, we are all facing the same threats, and we all put the protections in place, and we work with each other. In fact, we have a very aggressive outreach program where with the folks in the other organization, and there is also a larger effort through the Federal CIO Council to learn from each other and use our best practices, because we are all facing that threat today.
I agree, and this is where I'm trying to get at. And I think the gentlewoman from Indiana brought up a good point. States are trying to tackle this as they go, and I'm looking through, there's a privacy rights organization, Clearinghouse, that as we speak in real time is listing this Health Information Trust of Frisco, Texas, 111 records compromised. A dentist in Rochester, New York on June 3rd, theft of the laptop, 13,806 records. One, though, that comes in here, and I think it brings to the point of what we're trying to get at is Hampton Roads Health System, Newport News, Virginia, talked about employees accessing information incorrectly, and it even notes in this that they were fired for that, and then, of course, there's malicious content and all of that. The point I'm trying to figure out here is, when you do this, is data security an all-or-nothing zero-sum proposition? Is it an impenetrable firewall, or it's open access, or are decisions made in the business community as well as you that risk assessment and what is acceptable risk is in that? I'm assuming in the private sector now, and listening to Ms. Wolarski brought up a very good point, is there's a huge market in identity theft insurance, data breach insurance on that. Those insurance underwriters must be drawing some guidelines on what is acceptable risk and what is not. Does that pertain to what you're doing? Is the VA doing that very same risk analysis based on best practices of those underwriters?
Yes, sir. We apply those same rules. It is baked into the standards that we follow. The National Institute of Standards and Trust applies those to us. And to your question about is there an all or nothing, I think our partners at DoD found out with WikiLeaks in a secure system. you still could not guarantee the material would not.
But what I guess I'm asking for is it worth, and I'm going to come to this question, is what's the cost, have you figured, to implement OIG's recommendations? Is there a cost factor that takes into this? Say, for example, depending on where I'm at versus a high crime versus a low crime neighborhood, I might not invest in the most robust security system, taking and thinking into there hasn't been a crime in my neighborhood in 75 years. Those are things that we work in. Now, if I always want to be absolutely sure, I could go to the top of the line every time and implement that security. How do you view that at VA when you make those decisions?
So great question. Thank you for that question. We look at what the risk is. Is it something at the perimeter? Is it something inside? Is the data inside something that has the highest level of need or something that is just transactional data? And the amount of resources we apply and the controls we put in place are actually tailored to the information that's in the system and the potential risk.
Does OIG take that into consideration when they put out their recommendations? That what you're telling me is you are doing a risk analysis, a cost-benefit analysis. Is OIG asking or saying this is the ultimate perfect world, what it looks like in security, or are they factoring that in?
I believe my partners in the Inspector General Office are taking that into consideration, but I will tell you, they've done a fair appraisal in terms of the FISMA audit of areas where we need to continue our attention and focus. And I will tell you the one thing that tells me that we're on the right path is we did this massive program last year called CRISP, which was more than just IT. It was the leadership of the organization, the VHAs, the VBAs, the NCAs, so they got engaged from the senior levels of what do we need to do to secure the enterprise. And we are seeing the critical things dealing with personal attitude by non-IT folks, as well as IT folks, is changing to where it needs to be.
If I heard that right, OIG did say they didn't give an assessment based on it hasn't run its whole course yet. So what your assessment is at the end of this, when you go back and look at what CRISP did, we're going to see a change across the spectrum, culturally and robustness of security.
Yes, sir, we are seeing that change, and I will tell you the change will need to continue from here on out because we know that threat evolves with our change.
I'm going to use my last 25 seconds here. You're not going to get the opportunity to do this, but following you, Mr. Davis is going to speak, and there's going to be some questions of how things came out or why they came out. Is there anything you'd like to address? I'm out of time here. You know the situation, the memorandum, and how things are going to play out, and I think it's only fair that you be able to respond.
I would tell you, sir, I was perplexed by what happened and how it went down. I was troubled by the fact that there are two memos in circulation. A memo dated 29 January that I and leadership received, and a one that we received from the committee on that was signed on the 28th of January, that we were not aware of the existence of it until Friday when the committee staff gave it to us. And the memos are almost identical except for one paragraph. And that paragraph says, clear and present danger. I will tell you, if anyone tells me there's a clear and present danger, I pick them up and I walk them over to the IG and say, tell them what it is that I am missing here. I actually did that on the 29th with the memo received. That memo I took to the IG. On Friday, when I learned of the existence of a second memo, different than the one the department received, I took both of those memos and I reached to the IG and said, I need you to help me figure this out, because I cannot figure out why the department would get one memo with 4 paragraphs and the committee would get a different memo with 5 paragraphs, and the difference is clear and present danger. That was not communicated in the memo we received. And I'll tell you, I'm still perplexed on why that would exist.
Mr. Chairman, I thank you for indulging the extra time.
Mr. Pelosi for 5 minutes.
Thank you, Mr. Chairman. Mr. Warren, can you guarantee that the veterans in my district and the Indiana 2nd District have not suffered a security breach?
Ma'am, I'd be lying to you if I made that guarantee. Again, it is all about what the risks are, and we try our darndest. In fact, we do more than try our darndest.
But you can't guarantee that.
I can't. And in fact, nobody, if somebody sat here and guaranteed, you should haul them out of here.
All right, do you personally, sir, do you personally feel responsible for the fact that we have a nation of veterans that are vulnerable?
I care deeply that we are not further.
Do you feel personally responsible when you leave and check out at night and go home? Do you feel responsible for the fact that there are various security breaches in our whole nation's veterans are at risk?
Ma'am, I go home tired every night for all
Do you
the
feel
things that I
responsible
do.
for all the things that we talked about here today?
Ma'am, I'm personally responsible for the organization as the acting CIO.
Thank you. I yield back my time to Dr. Rowe.
Just a couple of questions, and maybe I've got through this before, but are the state actors, is that classified information? Because I've seen published reports. I mean, we've just had the Chinese in every headline in the world here saying, "Oh, it's not a big deal. It's not a big." We know it's a big deal. So who are the state actors?
Sir, as a young lieutenant, one of the first briefings I got when I came on board was that just because something is published in the press, if you receive a briefing that says it's classified, until the classifying authority says it's clear, it's classified, no matter what you read.
So the briefings you've had, I mean, what you've done right here, when you determine with what you're doing that somebody is trying to breach your firewalls and get into data that's in the VA system, that's classified information. You can't come here to this committee and say, this is what happened?
Sir, actually, you had asked me a different question, which was the naming of the actors. We work with Homeland Security on our boundary, so they are in constant communication with us. They are telling us when they see stuff. We are telling them when we see stuff.
We want you to tell us when you see stuff. So what's the problem with that? And I thought that we all work for the American people.
As do I, sir.
Well, I include you. I said we all, you, me, everybody in this room who's here, who's a public servant, works for the American people. Do they have a right to know who's trying to get into their personal information? I would like to know who's trying to get into the veterans that I serve, the 70-something thousand of them that live in Northeast Tennessee.
Congressman Rowe, we would be glad to come up and give you that private briefing with all of the material you would like.
I guess my question is a second question is, why is that classified? Why wouldn't that be public? When people are trying to steal from you, we ought to let the people in the world, in our country, know who's trying to steal our own veterans' information, I think. I think that's very important to be public. Why are we hiding that? I mean, that's above where you are. I understand that. But that's a philosophical question. Next question is that when we come back a year from now, I've been here now 4.5 years, and I see problems that linger on and on and on. Are we going to come back 1 year from now and have the same conversation? And I totally agree with you, Mr. Warren. When you were saying you couldn't absolutely guarantee, I've had people come to me when I'm taking them to the operating room and say, will you guarantee that I'm going to live through this? Well, I can't guarantee that. I got that. I understand that. But with as good a system, can we say a year from now that the IG back there who gave a very good report, you will have met those metrics that you agree with, and then you all work out if you don't agree with them?
Sir, I would like to take the 12 to 18 months the IG identified, but the intent is to clear as many of those as we can in the 12 months with the schedule we've given them, and to keep moving through those till we've cleared them all.
Okay, I yield back.
Thank you, Mr. Chairman. Mr. Eulskamp.
Thank you, Mr. Chairman. Mr. Warren, the IG's testimony outlined some pretty serious deficiencies in the Office of Information and Technology, and according to the evidence, VA's network has been accessed by foreign state actors since March 2010. And in that fiscal year and since then, you've received a grand total of more than $87,000 in bonuses. Can you explain how you merit such a large amount in bonuses?
Sir, as you're aware, the way the compensation system works in the federal government is a performance plan is laid on an employee, as in myself. Supervisor sits down and lays out what I expect from you in the year, and based upon how you do, there is an appraisal given. And basically,
so how you did it was worthy of $87,000 in bonuses. Is that your understanding?
I believe, as a result of me exceeding the performance expectations that my leadership have laid on me, I was recognized with performance awards of that amount.
Okay. I'd like to ask a question as well that you did state there were no absolutes in your mind in security, but we do have a letter here and a very absolute statement from your boss's secretary that says, quote, "To be clear, VA security posture was never at risk. Is that a true or false statement?
I would tell you, sir, as the person who ghost wrote that memo, in terms of doing the staff work for the secretary, I was not clear in my language, and I take ownership of that.
Is it true or false?
It is true with respect to the ATO process, which is this memo was trying to answer. With respect to the broader question, as we've already talked about today, there always is some risk. And so again,
So this was is this a false statement then?
I would not say it was a false statement, sir. I would believe...
Inaccurate statement, mistake. Mr. Lowe, let me ask you a question. Have you ever brought to Mr. Warren's attention that there are significant security issues that need to be addressed?
Congressman, thank you. Have I ever brought attention to Mr. Warren that there are significant security issues that need to be addressed? No, sir, I have not.
You have not?
I have not. Oh, sorry.
Usually I try to anticipate an answer, and to anticipate an answer that in your job you've never identified a single security risk really strains credibility. You're on a testimony. So you've never sent an email, never made a statement to Mr. Warren or his superiors that there are any security risks in the IT system at the VA.
I brief Mr. Warren and the Secretary frequently on security risks for the organization.
Do you know how many foreign state actors have been identified as perhaps intruding upon the system?
I know that there are foreign state actors that are...
Do you know how many have you identified? Is there one or more?
Individual state actors or...
individual states. Okay. It's a pretty clear question.
Yes, sir.
Have you identified more than one?
Yes, sir.
How many more? Mr. Warren said there was only one in his earlier testimony. How many more were identified?
How many more state actors that are actively trying to penetrate the network, or actors that have penetrated?
I'm guessing there'll be a second round of questions, so it probably doesn't help to try to stall. Would you answer the question? How many more?
Sir, I've been in this position for approximately 90 days. I'm still trying to ascertain the state of the organization. I'm still...
Have you seen any memos that would identify more than one?
More than one...
State actor. You believe there's more than one. Mr. Warren stated there was only one. You believe there's more than one. I'm asking how many more?
I don't know the answer off the top of my head, sir. If I could get back to you on the record, I would appreciate it.
Well, I will note for the committee, I've had a grand total of, I believe, 23 questions. I've been waiting for 264 days for your agency to respond. As Dr. Rowe mentioned, we're supposedly working for the American people. And when your agency, your bosses, refuse to answer questions, it looks like you're covering things up. When you say there's one state actor, he says there's more. He's only been here for 90 days. We've got a report from the people that work for you, Mr. Warren. You know this report. You know there's 8 actors identified on here. And you claim there's only one in your earlier testimony. I think that's embarrassing. It's not only embarrassing, we're sworn in our oath. And so I'm going to ask you one more time, how many state actors have you identified or believe are out there that have accessed the system for 20 million veterans and their dependents?
Congressman Hillscamp, I believe that question is directed to myself.
Is your name Mr. Warren? Answer the question, please. Let's get on with it. We're doing the business of answering questions. Please answer them. I come from Kansas. We don't go through all this trying to act like we don't know what the question is. I asked your name. Answer the question.
I would tell you that the department, through the NSOC, is aware of multiple state actors who are trying to take action against the department. My comment earlier, you referred to one. I said there was one published incident that was being referred to. I do not believe I said one state actor. If I did, I was in error. I'd like to make sure I correct that. I was referring to a report. I think, as Dr. Rowe indicated the report in front of him, there are multiple, and I will tell you it is more than just state actors. It is very known in the community that it is more than countries. There are syndicates who have this as a money-making activity. Right? So, and I believe that's also in the open press in terms of it's not just countries, it's individuals, it's groups of individuals, and it is not just veteran data they're going after, they go after your home, right? Your home computer, websites you go to, and there's a very aggressive effort, and I know the Congress is engaged in terms of what's notification, what you should notify, how we share, and how do we do all those things. It's something we
So you
try
believe
to
this
be
is-
very active.
But you're comfortable with the current security risk?
I am not comfortable with the current security risk, sir. And again, I will tell you the safest computer is the one you don't hook up to the internet.
Mr. Holzkamp, we'll do a second round.
Thank you, Mr. Chairman.
Mr. Warren, so we know that we've been hacked by a foreign actor. We know that, the VA system. We know that they encrypted in their way out, exiting. So we don't know what they took. We know that the system contains the personal identification, information for about 20 million veterans. So isn't it possible that they could have taken all of that, that there is an entity having hacked our system that has all the personal identifying information for our 20 million veterans? Isn't that correct?
Sir, I'm very concerned about stringing all those facts together and stating a causality. In other words, this means.
Well, okay, let's walk through it then. Number one, our system has been hacked, correct?
We are aware of incidents where
That's right.
individuals...
Number two, that they encrypted that they penetrated the system, and they encrypted on their way out, so we don't know what files they took. Is that correct?
In the incident referred to, there was data removed that was encrypted. Yes, sir.
So we don't know what files they took, correct?
We do not know what files they took out of the VA.
Had access to information pertaining to our 20 million veterans.
I would tell you, sir, that is the point where I diverge, because it's not clear where they had access, right? So you're assuming the VA is a small place.
You're right. We don't know. That's the problem.
Okay.
We don't know. That's right. And so the fact is that they had access to the 20 million veterans. Aren't you concerned about that?
Sir, I am concerned anytime veterans' data is put at risk.
Don't you feel that the veterans of this country, I being one of them, and there's some other veterans on this committee, ought to be warned of that fact?
I believe you are accomplishing that through this hearing, sir.
Should you have accomplished that?
To what end, sir? To drive veterans away from the health care they need, the mental health care they need?
To inform them that they need to watch out for the fact that the system had been compromised, just as any private entity that had been compromised would notify the consumers that they serve. You, in fact, had an obligation to notify the consumers that you serve, and that's the men and women that serve this nation in uniform.
Yes, sir, as I did. And anytime there is the potential, where we believe there is the potential of a breach, we offer credit
monitoring. There was a breach.
We offer credit monitoring. We offer credit monitoring for a year. We have a hotline to provide those services to individuals. In the past, we've received emails from Homeland Security.
Ranking Member Kirkpatrick.
I yield back.
Mr. Lamborn.
Thank you, Mr. Chairman. And once again, thank you for your leadership on this issue. Mr. Warren, it was testified under oath by the previous panel that when you own the domain controls, you own the network, and that is what happened at the VA. Would you agree with that statement?
When you have the domain controllers, you can go where you would like. That's not necessarily the same as owning the network. Owning the network means you control what anybody does or anybody can do and where all the traffic goes. That is not the case.
Okay. But if you're looking for information and you can go wherever you want to go, that's a pretty bad situation.
As I believe I've Yes, sir.
Can you tell me about the APO, the process, well, the certification process? I hope I'm using the right terminology.
Yes, sir. The authority to operate process is something that was established, I think, approximately in 2002 by the eGov Act. It was a paper process that was used, very routinized, very checklist-focused, very document-oriented to, if you are bringing a system online, are you putting it in a box and controlling all of the boundaries on the box in such a way that it was worth the risk to the organization for the system to run.
Okay, thank you. And so if you go to a vendor or if you go to someone in the VA and say, I want you to certify that everything's working properly and is secure, how long would it normally take them to do that?
So the ATO process is actually an ongoing process. Multiple documents are on different schedules on when they are generated and when they're updated. As an example, COOP-COG, which deals with what do you do if a system breaks, that gets checked and exercised on an annual basis. And in fact, every year the IG comes in and looks at, have you done that? That is a part of that. There's a system security plan, which is the description of it. There's the security controls in terms of what you're doing. There's the management controls in terms of what you put in place because technology can't do it. And there's a whole list of documents that you run through. Each of those are on a different schedule. So when you talk about certifying, there are multiple steps in the process.
Okay, and what would be a normal range, high end and low end, of how long that certification would take?
So if you're referring to the last two steps, which I will take you are, which is the individual looking at all of the material that exists and asking, is it relevant and correct? And then recommending authorization. I believe you can do that in 2 weeks to 30 days if you have a well-run organization.
2 weeks to 30 days.
For the last two steps of the process, as I said, all of the other ones are ongoing. Those last two steps are validating that the individuals below, the information security officer, the system owner, the facility, have actually done all the things and certified, attested that all of the information is correct, that it is current. So that certification process is not a go do a lot of work, it's make sure all the folks below you, all the processes you're responsible for have happened.
So if you accepted certifications like that in that 2 weeks to 30 days or 2 months process, then you would also be trusting that everything before those last two steps had been accomplished on an ongoing and regular basis.
Yes, sir. You count on the signature of the individual and the attestation that they did their job. And I will tell you, when we did this first cycle, of the 268 documents that were signed, I rejected over 40%. Because when I looked at the underlying documentation, which is how I do things, it did not meet the standard, and I sent them back to be redone. So the certifier said, yep, it's ready, but when I did that first set, 44% didn't meet it.
So you would not accept an ATO without all of the previous steps having been done on an ongoing basis up to the last two steps, and then reviewing it once again for those last two steps?
Yes, sir.
And you would not rush something through just to look good or something like that?
Sir, my signature means a heck of a lot to me. So when I sign something saying that I'm accepting the risk, I'm accepting that risk. And so I believe I laid out a responsible time period for something to be done. And I had an expectation that the individual would have done all the things necessary such that when it got to me, that it needed to be done. And in fact, the action was given in November in a meeting where the individual accepted the responsibility to do the job by February. It had been talked about prior to that in multiple meetings about the need to fix that process. I was expecting at the end of the process that all of the things they were responsible for had happened. And even though they were, I still checked and rejected the ones that did not meet the standard.
All right, thank you.
Mr. Warren, a quick question. Did you mislead the Secretary of Veterans Affairs when you had inserted the language in the letter that was sent to me on May 14th. To be clear, VA security posture was never at risk. Did you mislead the Secretary?
Mr. Chairman, I did not intend to mislead the
But
Secretary.
you did.
I don't believe I did.
You did, okay.
I believe my answer was within the context of the question, which was dealing with the ATO process.
Dr. Rowe?
Very briefly, Mr. Warren, one of the things that's most important, I think, at the VA or with when healthcare is trust. You have to trust not only the person that's seeing you, providing the care, but you've got to trust that that information will be protected, because many times it could be very embarrassing of something that occurred to you years ago that maybe current family members, other people don't know about right now, other relationships you've had, issues that come along, mental health care issues. That's why it's so, not just money, but that's why that's important. And I guess a question that I have, the VA has not done an exemplary job. In 2006 with the laptop, it took forever to notify people. Secondly, when the issue came along with the colonoscopies, that wasn't handled very well by the VA. And I don't think that veterans right now understand. As a matter of fact, I guarantee they won't until they see this hearing today and the word gets out among the veteran community that all their personal information potentially is at risk. And I guess the question I have for you is, are you concerned at all about your data in the VA, or if you go to the VA? But your own personal information, you.
Sir, I have no reservation about using VA benefits or services, placing the data, my data, in the veterans' hands, into my staff's hands, into the rest of the VA. I believe we would be doing a disservice to our veterans by telling them, hey, there's a disproportionate risk, and therefore you should not be coming to the VA for those services or benefits. We know health care, and as you've already talked about in other settings about mental health care and making sure our veterans get that, I would hate that the potential to drive folks away from the services and the benefits not only that they've earned, but they need.
But equally just as bad is to have that information once they've shared it with somebody, shared with the world. In a day, I think Mr. Lamborn said in a WikiLeaks drop, I think the most compelling thing you said, and I have to agree with you, the more I hear in these hearings I go to, is don't hook up a computer to the internet if you don't want somebody to know about it. Apparently, if we can't protect it, I mean, that's what you just said a minute ago. I don't know whether you said that out of exasperation or in fact, but I think when you hook it up, you may be you may be an open book.
I would tell you, sir, and it's a great area where we focus, and it's the training of our workforce. Our greatest asset and our greatest risk is our employee base. Because if you do something without thinking, if you do not think about where you go, in other words, if you go out to the internet and you say, free car, and you go to that website to get that free car, you're actually downloading probably malicious software. Within the VA, we protect against that. But when you're at home, if you go to the wrong place, or your child goes to the wrong place, or a visiting sibling or niece, you're putting that computer at risk. Right? And one of the programs that we have at the VA is we don't allow you to hook your personal computer up to the VA. We actually allow you to come into the VA through a virtual environment, so you don't bring any of the things you have on your home computer. In fact, at the Federal Trade Commission, before the virtual technology had really matured, we paid for antivirus protection for individuals' personal computer because we knew they had to use it to get into the VA to remote in, or into the Federal Trade Commission. At the VA, we don't have to do that because we protect by doing virtual. But the behaviors that we build at the VA, we want them to take home. Because if you're at home dealing with identity theft because you did a bad thing unintentionally, you really can't do your job at the VA as a result of it. Active aggressive education, posters. Some of the things that we have been exploring with, and we did it at the Federal Trade Commission, is you do spoofs, right? You send individuals email at work intentionally bad stuff. Right? And you want them to basically do it, and you pop up and say, don't do this for real, because if this had been a real one, you would have just compromised your system.
Mr. Waltz? Mr. Hillscamp?
Thank you, Mr. Chairman. I apologize for my emotion earlier. I have a 95-year-old veteran uncle who Purple Heart recipient who is facing some medical problems and thought that his records might be at risk. Is particularly worrisome to me, but I have a few more follow-up questions for Mr. Warren and his assistant and some budget issues. If I understand correctly, the VA intends to transfer almost $69 million to various IT efforts. Is any of that money destined for IT security?
Sir, so I can make sure I'm answering the question appropriately, is that referring to a reprogramming action that was sent up to the Hill, or is this something else?
That would be a reprogram.
This would be the reprogramming?
Yes.
I need to go back and confirm which accounts were being moved. I do not believe, in fact, I'm pretty sure that that transfer would not be degrading any of the efforts we're doing in information security. That the work that we need to do to continue CRISP and to support the work on the material weakness that the IG has identified.
Is it enhancing your IT? Is it enhancing your IT security efforts?
I would tell you every day we're working on enhancing our...
But with this transfer, are you moving money to enhance the IT security?
The primary purpose of those dollars, sir, the transfer is to move accounts, move dollars out of different accounts. I'm not sure.
I understand. Are you using it for enhancing IT security? Yes or no?
I will need to go back and confirm if we were moving funds into the information security accounts. I can't tell you that directly here, but I will get back to you, sir.
Okay. And the second budget question would be, it's my understanding that under your direction, the VA spent $14 million for a conference room, approximately $14 million for a conference room in Martinsburg, Virginia. Is that accurate?
Sir, I would need to take that one for the record. The number, I believe, is high, but I need to go back and pull the records up to confirm.
When you say high, is that in the ballpark? Is roughly, and I appreciate getting the actual figures, but your best guess is how much was spent on this conference room?
Sir, the reason I'd like to take the question for the record is Martinsburg is a facility that has multiple conference facilities in it. It is a place where we have the NSOC in terms of our security group, so I don't know if it's facilities we built for them. There's a location for the secretary and the leadership team. I don't know if it refers to that. We also have a command post for the IT organization in case we deploy there. So I don't know which one you're speaking to, so that's what I'd like to...
It would be, there's one here. It would be the room that has a plaque on the wall with your name on it. And I don't know if we have a copy of that. That would be the plaque that's on the wall. So if you're going to look for the room, and is it customary in the VA to put your name on a plaque on a wall?
So that's actually the plaque to the building. And I was the responsible official that worked with the Congress to get the funding for that location. And I believe if you look in any new building that's been built, the names of the individuals responsible normally appear on the plaque.
Well, I would actually say put about 300 million taxpayers on there as the ones responsible for the building. But aside, the last thing I want to ask you about, you mentioned credit monitoring services.
Yes, sir.
Who do you provide those to?
We provide those in any case where we believe there is the potential of a release of veterans' data.
And so you do that on an individual
on
basis?
An individual basis. A letter is sent out to each of the veterans where the data...
Do you know how many you've provided this for?
I will take that for the record and get it back to you, sir.
Okay, so you actually have identified individuals you believe their data is at risk and provided them credit monitoring services if they so choose.
Anytime we believe there was the potential of the information being released, we offer the credit monitoring protection to those veterans.
Okay, and I understand you don't believe anything's actual. You don't have actually any loss of data. It's all potential.
I would tell you, sir, we go the extra distance by offering that. We actually have a lower threshold for offering than anybody else because we want to make sure...
You know that how?
Based upon our communication with the industry and conversations with folks who offer credit monitoring. I'm not sure you'll find other government agencies who offer credit monitoring if there is the potential of a risk. I think the VA is unique in that regard.
I look forward to that information, the exact numbers of folks you've identified potentially at risk. Thank you, Mr. Chairman. I yield back.
Potentially, I think that number is about 20 million. Mr. Warren, thanks so much for your testimony today. Mr. Lowe, you're excused. Both of you, thank you. Stay around. I think if we have time, we'll do that classified setting after Mr. Davis gives testimony.
Right.
On the last panel today is Mr. Jerry Davis, former Deputy Assistant Secretary for Information Security for the Office of Information and Technology at the Department of Veterans Affairs. So okay, good. Before I recognize you, Mr. Davis, I ask that you please rise and raise your right hand. Do you solemnly swear, under penalty of perjury, that the testimony you are about to provide is the truth, the whole truth, and nothing but the truth? Very well. Please take your seat. And you'll be recognized for 5 minutes, Mr. Davis.
Chairman Kaufman, Ranking Member Kirkpatrick, and members of the subcommittee, thank you for the opportunity to convey my concerns to you regarding the protection of information systems and information, which includes sensitive veteran data at the Department of Veterans Affairs. From August 2010 until February 2013, I've served as the Deputy Assistant Secretary, Information Security, and Chief Information Security Officer at the VA. As a DAS-IS, I serve as the most senior civil servant staff member within VA, with responsibility for oversight and accountability to protection of VA information, VA privacy, records management, and the Freedom of Information FOIA Act process. At the time of my departure from VA in early February 2013, I was one, if not the longest serving Chief Information Security Officer in the federal government, with nearly a decade of service in that role spread across multiple federal agencies. I'm also a Marine veteran, having served in combat with distinction during the first Gulf War, so the appointment to the position as a VA CISO has special meaning. It was a position that I did not take lightly, and I still am extremely proud to have had an opportunity to serve our country, and equally proud to have had an opportunity to serve the veteran community. My time at VA was largely filled with a great sense of pride because of the purpose and mission of VA and because of my role, which had a direct and positive impact on the veteran community. However, there came a time at the end of my tenure where my pride turned to serious consternation, and that consternation remains to this day. In nearly 20 years of building and managing security programs across government and private industry, I've never seen an organization with as many unintended security vulnerabilities. Upon my arrival in late August 2010, I inherited results of more than 15 continuous years of an unintended and documented material weakness in IT security controls. This material weakness included more than 13,000 uncompleted IT security corrective actions. These 13,000 corrective actions will require more than 100,000 sub-actions to fully remediate and manage IT security vulnerabilities and improve the VA security posture. In early September 2010, I was also advised that nearly 600 VA systems authority to operate had expired, and there was no plan in place to bring these systems into compliance. Despite the voluminous number of uncompleted corrective actions and expired ATOs, the most concerning issue was a conversation I had with the VA Principal Deputy Assistant Secretary, Steph Warren, who told me shortly after my arrival that we have uninvited visitors in the network. Further discussion with the VA Network Security Operations Team indicated that VA became aware of a serious network compromise in March 2010, and these uninvited visitors were nation-state sponsored attackers. Over the course of time while working with the VA INSOC and external agencies, I learned that these attackers were a nation-state sponsored cyber espionage unit, and that no less than 8 different nation-state sponsored organizations have successfully compromised VA networks and data or are actively attacking VA networks, attacks that continue at VA to this very day. These group of attackers were taking advantage of weak technical controls within the VA network, lack of control such as encryption on VA databases holding millions of sensitive records, web applications containing common exploitable vulnerabilities, and weak authentication to sensitive systems contribute to successful, unchallenged, and unfettered access and exploitation of VA systems and information by this specific group of attackers. During my tenure, I consistently ensured that each instance of attack or compromise by these groups or attackers was documented and communicated to the VIT, OIT leadership through specialized reporting called Key Investigating Reporting performed by the INSOC Deep Dive Analysis Team and biweekly security meetings with the VA Principal Deputy Assistant Secretary, Mrs. Jeff Warren. From late 2010 until my departure in early February 2013, I planned for and executed with support from various sub-offices within OIT a series of initiatives and activities needed to improve network and system security with a particular focus on defending the network against sophisticated and targeted attacks levied by nation-state sponsored organizations. Some of these initiatives included a web application security program, the VA software assurance program, continuous monitoring and diagnostics of VA information systems, mandating encryption of all VA databases, and supported the reduction of the total number of VA databases hosting sensitive veteran information. During my tenure at CISA, with the support of VA as a whole, we were able to close more than 10,000 of the 13,000 security corrective actions. And all VA personnel executed more than 100,000 sub-actions. While these actions did improve security from a compliance perspective, there still existed a problem of fully implementing adequate technical security controls needed to defend network systems and system information from nation-state sponsored attackers. The heart of selecting the proper technical controls meant fully understand the threat actors, their tactics, techniques, and procedures, and along with systems and network vulnerabilities, and implementing a program that could continuously report on and remediate identified vulnerabilities in a near real-time fashion. Over time, the Office of Information Security worked to enhance a comprehensive program called Continuous Monitoring and Diagnostics that would provide adequate security of VA systems and networks by continually evaluating certain technical controls in a near real-time fashion. There's proof that a good CMD program monitoring that correct controls can significantly improve information security and is consistent with the direction that the federal government has taken in securing federal systems. It is also significantly superior to even a good paper-based ATO process. It is my testimony at the time of my department from VA that the process required for the DAS to make an attestation that VA systems were adequately secure was completely faulty and improper, and implementation of the process exposed veteran systems and VA information to further risk of compromise. It was confirmed to me by the VA information security staff charged with executing the process that it was flawed, provided no value, and that providing a positive attestation to the adequacy of security controls would seriously compromise the integrity of the VA security program. I subsequently conveyed this message to the Assistant Secretary and the PDAS by formal memorandum and in conversation to the PDAS between January 15, 2013 and January 23, 2013. VA Handbook 6500.3 states that the DAS is responsible for reviewing all CNA packages and making a decision recommendation to the authorizing official to issue an IATO, ATO, or denial of authorization to operate, and providing an IATO extension in the event local management can demonstrate continuous monitoring and security due diligence are being provided. In accordance with VA information security policy and following VA information security procedures as a DAS-IS, I elected to recommend a denial of authority to operate and also elected to recommend movement of VA systems over the course of 8 months into an enhanced continuous monitoring program where systems technical controls can be centrally managed and evaluated in a near real-time fashion. I based my decision on the guidance provided by the information security team on the fact that paper-based processes would not keep highly sophisticated nation-state sponsored attackers from further compromising VA data. Furthermore, as each VA system was transitioned into the continuous monitoring program, additional specific critical controls would be evaluated for adequacy before being fully granted a full ATO. These additional critical controls are proven to slow and repel sophisticated nation-state sponsored attackers from compromising information systems and data. This was an agreed upon process with the VA information security team and a process that had been briefed by me to the Director of IT Audits and Security within the VA Office of the Inspector General several weeks before the process implementation. Despite the authority granted to the DAS-IS to make the recommendation to deny authorization, the VA OIT DAS made a concerted effort to circumvent my authority and influence my division to make a recommendation to an accrediting official that 545 VA systems be given an interim authority to operate. Furthermore, VA Handbook 6500.3 and VA Policy 6500 provides no role or authority for the PDAS OIT with regard to the program or processes governing authority to operate. To this end, I would recommend to this subcommittee some recommendations. Review all key investigation reports and deep dive analysis reports and web application security program reports to assess the damage and depth of exposure, extent of compromise to VA systems, and compromise of veteran information. And regularly report to the House Committee on Veteran Affairs on progress made with respect to mitigating access to VA systems and veteran information by nation-state sponsored organizations. Assess previously identified web application exposures and assess for potential compromise of veteran data, both PII and PHI. Include web application exposures as part of the data breach core team evaluation process. Assess the potential compromise to non-VA networks sharing an interconnection with VA's network. Designate the VA network as a compromised environment and establish controls that are effective and to support the reclamation of control back to VA from nation-state sponsored organizations. Move the VA system into a full continuous monitoring and diagnostics program with near real-time situation awareness of its security posture with a focus on the 20 critical controls. Increase VA funding for information security programs and number of information security officers supporting VA field offices and facilities. Move reporting lines for the DAS information security directly to the Assistant Secretary OIT or to the Office of the Secretary VA. Assess the past and present practices of the OIT leadership with regard to decisions made in the protection of VA systems and information. I would like to thank the members of the subcommittee for your time today, and I look forward to any questions you may have.
Thank you, Mr. Davis. Mr. Davis, in your experience, what would be the intended use for their access once these actors gained access into the network?
It's the actors, once they get inside the network, depending on what their goals and objectives are, could be a number of things. So initially, once they get inside the network, they establish a foothold, and that foothold is actually meant and designed to allow them access into the network at another given time. So basically what they do is they install backdoors into the network. Once they're inside the network and they've established those backdoors, they then attempt to move laterally throughout the network by compromising passwords, usernames, and things of that nature, and elevating their privileges so they can further move throughout the network and start looking at systems to potentially compromise. Their long-term objectives is to maintain a presence inside the network for whatever they need to do. So by maintaining a presence means that they'll attack multiple systems. They'll continue to steal passwords, usernames, things of that nature, that they can maintain their presence, and then essentially take whatever data that they deem may be important for them.
Can you elaborate on these sophisticated attackers?
So within VA, I saw we dealt with approximately 8 different types of attackers or groups or organizations. And looking at reporting that was put out by industry experts, particularly a report in February of 2013, Mandiant, they identified attackers coming from the People's Republic of China, the People's Liberation Army. And information that I had at the time and looking back, when we did the analysis on those individuals, we identified that it was also the same groups. That one of the groups that we call were the comment crew, and they are known to be sponsored by the People's Liberation Army.
Mr. Davis, how does an organization defend against these sophisticated attackers once they are in the network?
Once they're in the network, you have to, once you understand that they're in the network, you have to do something which I call is you're in a compromised environment. So there's a number of things that you need to do to understand how do you reclaim that environment. The first thing you need to do is identify which systems were compromised, do a forensics evaluation if you can on what was actually taken, remove users from resources around the network, and then do things such as look at what we call indications of compromise. So these are basically digital fingerprints that we would have of different groups that have compromised other environments, and we now have their fingerprints. You will look for these indications of compromise, and then basically go back and remediate all of those areas where you believe the compromise took place or where you know the compromise took place. So if you know that the compromise was a missing patch, you have to start patch those systems. The problem is once you realize that the individuals are in the network, on average, they've already compromised the environment for generally up to a year by the time you figured out they've been in the network. So you may go back and patch a particular system, but they've already established backdoors elsewhere in the network. So it becomes sometimes chasing your tail around and around in circles and trying to identify where they are. So you may patch, but they'll pop up again somewhere else. So it takes over time, a number of years, months to years, to go through the organization systematically and plug these holes. DoD puts out a very good document. It's not classified. It's sensitive, but it's not classified. That is called Operating in a Compromised Environment. And it teaches organizations, its instructions on how you actually operate in a compromised environment and reclaim that environment.
Mr. Waltz?
Thank you, Chairman. Mr. Davis, thank you. Thank you for your service both in uniform and after. I'm going to try and go back at this issue of, because I think the issue of security and veteran security is paramount. The accusations that have been laid out, I'm going to get at this and try and figure it out. Can you tell me, was this issue over you pointing out that there were problems, did that lead to your departure from VA?
The problems at VA didn't lead to my departure. Like I said earlier, we had to work through a tremendous number of corrective actions. You know, as I said earlier, I worked through about, of the 13,000, we had gotten through about 10,000 of them. At that time, I felt that the work that I was doing at VA, some other opportunities came up. I had an opportunity to move back to the West Coast where I'm from originally and be closer to my family out there, was part of the reason why I elected to move back to...
Because you signed off in, if I'm right here, in August 31st of 2011, you did the extensions on the ATOs.
That's correct.
And then again, you met with Mr. Warren on November 29th about the expiring ATOs, and then on December 21st, you informed him of your resignation. It's just personal timing on all this is why this hit like this?
Yeah, it was the timing. I had actually notified the previous Assistant Secretary, Mr. Baker, before November that I would be departing. I had just had a one-on-one with him and said that I have an opportunity to go back to the West Coast. I don't have anything in writing, but there is been a formal offer. When I get the formal offer...
So this was all prior to December 31st on the expiring ATOs.
That's correct.
Why would they have asked you when they knew you were leaving? You'd already signed on to these. Do you think it was appropriate at that time? Now, you say, the thing I'm going to get at is that under duress, what did they do or ask you to do that violated your conscience on this to sign these things?
The process for to do the authority to operate, to sign off that says, that gives my attestation that the systems are adequately secure, the process is pretty involved and very extensive. So the problem that I had was that the process was asked to be short-circuited. In other words, an email had come out from the OIT front office indicating that Mr. Warren wanted all the authorities to operate to be signed by time I left, and that was 2 weeks. This is January 11th. So my team forwarded that to me.
Why didn't you just say no and walk away? Because what you're asking here is signing off on a system that is going to possibly lead to the breach of this. You knew it wasn't working. You knew that there were violations made, but by putting your name on it, it gave the authorization to move it forward. You were already leaving your job and had notified them, and then a month later, a memo is sent, and I'm going to get to that in a minute, 2 different ones, and I find out about it here for this hearing. I'm still trying to get at this.
Yeah, at that point, I did say no to, in writing, the memorandum form to Mr. Baker, and that would have been on or about January 15th, immediately after I became aware that I was needed to sign these before I had departed. And the memorandum that I sent to Mr. Baker, I said that it's improper because all of the activities that is needed to make a decision on authority to operate can't be done in 2 weeks. I said there's going to be errors and omissions, and that it was improper and we would jeopardize the integrity of security.
Did someone threaten you?
I wouldn't say that no one threatened me, but basically I was told that I would not be given a transfer date. A transfer date would not be given to the agency picked me up until I signed off on the documentation.
Who told you that about the
Mr. Warren.
Mr. Warren said you would not be given a transfer date if you wouldn't sign on a document that your conscience told you was wrong.
That's correct. And that was, I contacted the senior executive HR, and because the new organization was contacting me and asking me when was I going to be coming on board, because I had told them back in December that I would give VA 30 days, work through whatever I had left to do, and I would be coming on board. At this point, they're contacting VA. They're asking, when am I going to get a release date? I contacted HRSCS, and I was told that Mr. Warren said that you would not be given a release date because you still had a project to finish.
Did he miss this last paragraph in the memo you gave him? The one I have here says, I attest that there is a clear and present danger and risk of exposure and compromise of the sensitive data. He testified under oath that he never got that this was added to the letter that was sent to Congress on January 28th, and on January 29th, he got the letter without that there.
He did indeed, sir, get a different copy.
Why?
Let me explain what happened. That was the original letter that I had written, and that letter was on an internal, a letter that was going to VA internally, and it had concurrently copied all the members of Congress. My business office came back to me because we were putting it through the official VA system. My business office came back to me and said, we don't concurrent copy members of Congress on letters of these type. They get an individual memorandum. So I said, okay. So they went ahead and drafted the individual memorandum in the background. Meanwhile, what I did was I had someone look at the letter, and the editing they did on the letter, they said, they didn't like the language. They said, I don't like the language. They said, you probably should change this language at the bottom. It sounds a little bit dramatic and that sort of thing. So
well, when I read this letter, the most important paragraph is the last one.
Yeah, it was, someone told me that the person I asked to look at it thought it was overly dramatic. I said, this is a dramatic thing, maybe it is. So I did change the letter, but what had happened was I sent that inside. But then later on, before I left, I had gotten the copies of the original letters that came up here to the members of Congress, and those had went out.
Okay. I yield back. We'll wait if there's a second round of questions.
Mr. Lamborn.
Thank you, Mr. Chairman. Continuing on these ATOs, Mr. Warren testified that in a well-run organization, you can finish up the last two steps prior to signing off on an ATO in as little as 2 weeks. Now, you did not feel that was appropriate, though, and why not?
Because the team that was putting together, which was the security team that worked under me, that runs the what we call assessment and authorization process, they looked at the process. They put together the process, looked at it, brought it to me, and said, "Sir, do not sign these. The process is not good." But I already knew that just by looking at what was coming up to me for me to sign, that it wasn't a good process.
So in an ideal situation, if it was a well-run organization, you could do that. So you're saying it wasn't a well-run organization?
The ATO process that was taking place at the very end was not the general ATO process that we had done in the 2.5 years that I had been there. It was cut short, very abbreviated to make this 2-week time frame. And I said, there's no way that you can certify and accredit 600 systems in a 2-week time frame by going through all the controls. The bigger problem that I had was there's a checklist, and some individuals already testified to this, that on that checklist, we were asking people out in the field to validate that the controls had not changed. My team that came back to me and reaching out to the field, one of the reasons they told me not to sign the documents, because the individuals who were supposed to sign off on a checklist delegated the authority down into the organization to hurry up and meet the time frame. So you had individuals that had no concept about the security posture of the system checking off on this checklist and then sending them up to me for signature, and I just refused to sign them.
Okay. Thank you. That's very illuminating, and I'm sorry that we're even in this posture today. I'm sorry that we're having to have this hearing. You mentioned encryptation, and others have talked about that. Was it a negligent practice or a deficient practice not to have veterans' personal information encrypted so that one of these up to 8 state actors or state-sponsored or outside actors, had they accessed it, it would have been not usable to them?
That's correct. Encryption of any sensitive data is a general policy. When I got to VA and we started looking at the VA policy, which is Directive 6500, encryption on databases was basically optional. So in 2012, I said, absolutely not. I'm mandating that all databases be encrypted because of the issues of individuals being in the network who could quite pretty simply, once you got into the database, you had everything that you needed.
Now, those of us, some of us anyway, on this panel have been concerned about what would have been able to be accessed. Am I correct in assuming that this would include, of the 20 million veterans on the system, Social Security numbers and names, ages, and possibly Social Security numbers of dependents and sometimes personal health information?
Sure. If some of the systems that were compromised, if they had that information in them, obviously it would take that. In some of the studies that my organization did, when we're looking at web applications and web applications that have a database connected to the back end that has veterans information, my team will run security software tools, and it will tell them if that application is vulnerable to attack and how easily it is vulnerable and exploitable. My team at that time found a number of applications that had veteran information, 30 million instances of veteran information that was exploitable, and they exploited the system to show that it was exploitable inside those systems. Social Security numbers, date of birth, so on and so forth.
And what about, and I don't know if there's going to be a second round or not, but what about, I may have to pursue this later, but what about access to other networks? Like I know DOD and VA interact a lot, at least in the healthcare issue. What possible access could this allow if someone was controlling VA, or at least had domain control, to get into other networks?
Yeah. As we talked about earlier, the team did these key investigative reports. So specifically looking at the nation-state sponsored attackers. And one of the compromises that they picked up on, this report was right as I was leaving. This came out on January 9th, 2013. There was an incident that took place where the team, and I'll just kind of read it, it says, the team Centauros typically gains initial access to an enterprise via spear phishing by moving laterally previously through compromised trusted networks. I'll jump forward in this report, and what they have said is that has targeted and compromised one or more systems within the Silver Spring office site code, many of which are virtual private network users. Based on information collected from open source intelligence and interviews of targeted users, the deep dive analysis team considers the bidirectional health information exchange program to be a high value target for this team. The BHIE program is a joint information technology data exchange initiative between the Department of Defense, DOD, and VA. The team may be interested in the data residing in the system and in the network interconnections between the VA and DOD, allowing this program to function, or both.
Thank you.
Go ahead. Dr. Poe.
Thank you. The couple of things I want to just go over very quickly and then yield my time. In March 2010, these uninvited visitors were nation-state sponsored attackers. Over the course of time, while working with the VA, the NSOC team and external agencies, I learned that these attackers were a nation-state sponsored cyber espionage unit, and that no less than 8 different nation-state sponsored organizations had successfully compromised VA networks or data, or were actively attacking, not necessarily compromised, but attacking VA networks, and attacks that continue at VA to this day. Is that the correct statement?
That's correct.
So to this day, today, perhaps, these attacks are taking place. The other question I have is that I think you just stated, and you said the PLA without any hesitation. Why would, I guess we'd have to ask Mr. Warren that, why couldn't he say the PLA? Just mention that. It's not any big secret to anybody.
It's in the public domain.
Yes.
And that's where I'm going off. I'm going off of a report that came out in the public domain that lists these groups of individuals, organizations, and based on that information that's in this public domain report, we could accurately say that those are the same individuals. Even the nomenclature is the same.
And this is, I'm not a technical person, so stop me if I'm off base, but you mentioned that once that system had been compromised, that piece of malware is in the system, there are ways you can operate around it.
Yeah.
But would encryption work once you've been compromised? Once that malware, do you follow me? Once the
right. It depends on what exactly the malware is that they put on the on the system. Your encryption would be of little value to you if once the malware is on the system, the malware can then go out and call down other tools into the environment.
Okay.
And some of the tools that they do remotely is they pull down keystroke logging. So if they have those types of tools, a keystroke logger on that system, when you go to log in to decrypt, they've got the decryption password for that system.
So you get your password that way?
That's correct.
Wow. And do you know that's happened? I mean, can you, when you've got the system up now, let's say you're back there, would you know that it's happened to you? That they swiped the password?
We know that the way these individuals work, that it is a typical tactic for them to, if they compromise something such as a domain controller, as was said earlier, or particularly the domain controllers, the domain controller has a file on it called the SAM file. And that file is the Securities Accounts Manager. In that file are all the password accounts for the users in the network. So if they've got the domain controller, they will grab the SAM file. When they encrypt the information, generally, if it's going out and it's encrypted, I know they hit a domain controller, guaranteed they probably took the SAM file. They're going to go back, crack it later, and going to take every password that was on that system.
So you better change your password pretty often.
So you would have to, you would have to change all the, but the problem is if you've compromised the domain controller, you have to change the password to the domain controller as well, because they're on the controller. If you're just changing passwords without changing the domain controller, they're just grabbing that as it goes along.
Well, I want to thank all of the people here today. Ms. Halliday, you certainly, your team and every one of you, I've learned a lot today, and I think we'll continue. And Mr. Chairman, thanks for holding this hearing.
Mr. Hillscamp.
Thank you, Mr. Chairman. I just want to follow up on the statement that Dr. Rowe mentioned, and which you stated that you learned about these attackers were a nation-state-sponsored cyber espionage unit in no less than 8 different nation-state-sponsored organizations. Who told you this? How did you determine that? And was that common knowledge in the IT network?
It was put together through information that the VA Information Security Team, they're called the Enterprise Network Defense Team. They put that information together because they track, as Mr. Warren stated earlier, they track all these issues across the network. They produce these reports. They would send them to me and Mr. Warren and a couple other folks, and I would read through them and work out a plan of action or strategy to work through this.
So the report you mentioned, which I believe we have a copy, multiple reports. So Mr. Warren received these reports as well?
Yes, he was on that email distribution list. I think it was only Mr. Warren, myself, and maybe one other person. There's like 3 people.
Had you discussed this issue of nation-state-sponsored organizations with Mr. Warren?
We did at time to time. Initially, when I first came on board at VA, he told me that we had uninvited visitors in the network. I pretty much knew what that meant. I had dealt with it before. And then going on in subsequent talks from time to time, I had a biweekly security meeting with Mr. Warren. It would come up about these attackers in the network. If we had an incident, it might be the topic of the day that we had an incident and we're trying to work through it. So yes, we definitely talked about it.
And above Mr. Warren, did you discuss with any of his superiors about that, or did you just leave it in his hands?
I generally, my reporting line was to Mr. Warren. So generally, I didn't have a great opportunity to talk to folks above Mr. Warren.
Did you ever email them with the information or include them on a email distribution about this issue?
No, we just worked directly with Mr. Warren on those things.
Yeah, and I think you were here earlier, but a statement from Mr. Shinseki indicates that. Again, to be clear, VA security posture was never at risk. Your opinion on that, Mr. Davis, is that an accurate statement?
I would say that it's not an accurate statement.
Okay. Did Mr. Warren ever tell you that was an inaccurate statement? Did you ever discuss something along these lines?
At the time when we were doing the ATOs in the memorandum, and at a time when he visited my office, I believe it was January 22nd, I said that that the process was just bad, and it would basically, as I wrote in the memo, I repeated the words that it jeopardizes the integrity of the security program.
Okay. And lastly, I didn't get a chance to ask questions on this issue, but recently it's come up that numerous other secretary and high-level individuals in Washington have at times used private, apparently non-secure email systems to communicate and to conduct business. Do you know if that was occurring at the VA?
I couldn't say definitively. I would suspect that people do that, but I have no direct knowledge that anybody was doing it. Mm-hmm. I was not asked to investigate or anything like that.
Okay. Were there any VA policies about doing that?
I believe there is a VA policy. I believe it would be more on possibly on the HR side of the house, but it may also be in a security policy that official business you have to conduct using VA-provided email systems and things of that nature. But I don't know the exact policy that would be, but I'm pretty sure that it's in policy.
Okay. And then lastly, Mr. Chairman, do you have any, I wasn't trying to figure out what you were doing in personal time, but the testimony you've given sometimes is not matched up with earlier testimony that, as I understood that, do you have any printed out emails or anything in your possession that would help establish the veracity of some of the discussions today, or is that all retained entirely by the department?
Any of these anything that I have with me, it's free to go to the committee. Some of this is off the public internet, and some of them are internal VA documentation, and email systems information, things like that. Some of them I would be concerned that where there are system compromise or system issues, exposures of data, that it identifies a particular vulnerability and the system. So I would ask that the system piece of it be stripped out.
Yeah, I understand. Last, Mr. Chairman, Mr. Davis, if I understand, you have 20 years of experience in the private and public sector dealing with system security, and it still is your recommendation that the VA network should be designated as a compromised environment. Is that still your?
That's correct.
Okay. Thank you, Mr. Chairman. I yield back.
Thank you, Ms. Hulskamp. Does anybody have any questions they'd like to ask? Very well. Our thanks, Mr. Davis. Thank you very much for your testimony today. You're now excused. It is obvious from what we have heard here today that VA needs to take action to improve its IT security. The subcommittee looks forward to working with VA to address these serious deficiencies and ensure that all steps are being taken to safeguard the information of our veterans. In that vein, I ask that in 30 days, VA provide this subcommittee a specific plan to address all of its IT vulnerabilities. I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include extraneous material without objection. So ordered. Mr. Weaver, the committee will be in touch with you to establish a date and time for a separate meeting for a classified brief. Mr. Warren, I'm sorry. Mr. Warren. Okay. And I'm looking at you. Mr. Warren. Okay. I would like to once again thank all of our witnesses and audience members for joining us today in conversation. This hearing is now adjourned. Thank you.
Great, sir. Thank you. Thanks, Mike.
Thanks, Tim.
Yeah, thank you, guys.
Sir, if you need any background, we spent a number of months on this, so I can give you quite a bit of background on it. And that might help remove some of the clouds of what was trying to be